Testing, testing.
All right, could all members and staff please turn on your video and stand by for call to order? Awesome. Chair, broadcast is ready, and you may call the meeting to order when you're ready.
Thank you very much. We appreciate that. So with that, good morning, everyone. I'd like to call this legislative subcommittee meeting of the Legislative Commission to order. Today is Monday, January the 25th. If I could please go ahead and have, I believe, Ms. Kaufman call the roll.
Thank you, Madam Chair. Senator Brooks.
Here.
Senator Cannizzaro.
Here.
Senator Dennis.
Here.
Senator Don Deralup.
Here.
Senator Severs Gansert.
Here.
Senator Goycochea.
Here.
Senator Hammond.
Here.
Senator Kekeffer.
Here.
Senator Ratty. Senator Ratty. Assemblywoman Benitez Thompson.
Here.
Assemblyman Frierson,
Here.
Assemblywoman Gorlow,
Here.
Assemblyman Hafen,
Here.
Assemblywoman Howdicky,
Here.
and Levitt,
Here.
Assemblywoman Miller,
Here.
Assemblywoman Monroe Moreno,
Here.
Assemblywoman Peters,
Here. Sorry, clicked the wrong button.
Assemblywoman Roberts,
Here.
Assemblywoman Titus,
Here.
Assemblywoman Tolles,
Here.
Assemblyman Watts,
Here.
Chair Carlton.
And I am here. Good morning, everyone. Thank you all very much for being here. So with that, our next agenda item is to go to public comment. We will accept public comment this morning. As noted on the agenda, it can be made by calling into the call-in line, submitting it by fax or by email. We'll take up to 30 minutes of public comment at 2 minutes apiece, and we will finalize our public comment at the end of the day. So with that, broadcast services, do we have anyone in the queue for public comment this morning?
We do, Chair. Caller with the last three digits of 650. Please slowly state and spell your name for the
Good
record.
morning. Good
You'll
morning.
have
Can
2
you hear
minutes.
me?
Yes.
Good morning, everyone. For the record, my name is Maria Shellhays, and I'm a professor at the College of Southern Nevada. From September to December of 2020, three
It seems we're having some
three full-time
difficulties on our
faculty
end. 1
members.
second, please.
No problem.
Should I continue? Hello?
This is broadcast. Give us just one moment.
Hello?
Yes, I'm here. May I continue?
This is broadcast. Please keep going. Thank you for your patience.
Okay. For the record, my name is Maria Shellhays, and I'm a professor at the College of Southern Nevada. From September to December of 2020, 3 full-time faculty members in my department passed away. 2 related to COVID-19 complications and the other to breast cancer. Dr. Jet Mitchell, one of the 3 professors who passed, was a community college representative on the PEB board. Dr. Mitchell was an advocate for faculty and often spoke up about the need to improve quality health care options while reducing and maintaining the health benefit costs for faculty. As a Faculty Senate Chair at the College of Southern Nevada, I received many emails and phone calls from faculty who are extremely concerned about the proposed benefit changes. Please consider the following. With a 4.6% furlough in place, is it responsible to increase rates or decrease coverage options? Is it responsible to reduce or eliminate long-term disability coverage, which often provides a much-needed safety net for those who need it most? Is it wise to increase the benefit cost of retirees? Consider for a moment how cuts in benefits will affect faculty retention and recruiting efforts in our state. If we do not have our health, we have nothing. Now is not the time to eliminate or reduce any aspect of faculty health benefits. Any changes affecting the health-related quality of life or well-being of any employee group would be a mistake. Thank you for your service, and thank you for listening.
Caller with the last 3 digits of 853. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Doug Unger, UNGER, Nevada Faculty Alliance, Government Affairs, and member UNLV Employee Benefits Advisory Committee for the record. Thank you, Chair Brooks, Chair Carlton, and members of the subcommittee for your service today. For agenda item 3, the latest PEB plans to meet the governor's mandate for what amounts to now approximately 4% cuts in benefits, we express disappointment, especially that all 3 plans carry such high out-of-pocket maximums that they intend to balance budget shortfalls from the bodies of the sick. We request plan designs that lower out-of-pocket maximums by raising premiums modestly, which would more justly achieve what good health insurance should by using contributions from the healthy to pay for those in need. The proposed elimination of long-term disability insurance for PEB is dangerous and cruel for workers who by state and federal agreement are not covered by Social Security. Tens of thousands do not have enough accumulated in PERS to be able to survive a disabling condition for very long. And the 7,000 higher education faculty who teach our young people and contribute more than 2 times in economic impact than what they are paid in salaries would be left with nothing should they face an illness or accident that prevents them from working. No income, nowhere to turn. PEB asserts that it will offer voluntary insurance at what we estimate would cost from 1% to 3% of salaries, 5 to 10 times or more than the current LTD insurance in PEB. But it cannot make this happen for at least a year. During the COVID-19 pandemic, this is asking teachers to do their jobs on a tightrope without a net. Right now, I know 2 faculty members at UNLV who suffer serious lingering effects from COVID-19. One chronic heart issues, another what she describes as brain fog, a reported neurological syndrome of the disease. What happens if they must apply for leave that outlasts medical leave until they recover? What if they don't recover? GovRec would see them left with nothing, not even a roof over their heads. Actuarial statistics inform us that between 100 and 150 state employees face disability every year. But who knows what more the pandemic will bring. A verse in Ecclesiastes reminds us that time and chance happen to us all. Eliminating long-term disability insurance for state workers is wrong. Please restore it and find another way. Thank you.
Caller with the last 3 digits of 338. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning, Chair Carlton, members of the subcommittee. This is Priscilla Maloney, PRISCILLAMALONEY, representing the AFSCME retiree chapter of Local 4041. We would like to wholeheartedly support and endorse everything that has been said up to this point by our other commenters, and simply tell the committee that we are submitting a written public comment as well with some relevant links to the appropriations bills from a bill from 2019 and also the current proposal that will be put forth to the PEB board on Thursday, January 28th this week. The $2 cut per year of service for the Medicare retirees who are on the Medicare exchange, and they get that amount in their HRA accounts, that would actually save the program less than $4 million, and it would result for those Medicare exchange retirees who have 20 or more years of service, it would result in the equivalent of a 20% cut in benefits, not a 3 to 6%, as you will hear some discussion about today. That is because the Senate Bill 550 from the 2019 session caps the appropriations for the Medicare retirees at $260 or at 20 years of service, whichever is higher. And this would actually lower that by $40 a month. And for folks on a fixed income, again, that could result in a catastrophic cut. So thank you for your service. I thank you for your time, and I appreciate so much the comments of those who have gone before us this morning. Thank you.
Caller with the last three digits of 338. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good morning, Chair Carlton. This is Priscilla Maloney. I believe I just gave my testimony. Were you folks able to hear it?
Yes. Caller with the last three digits of 837. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning. My name is Irvin, E-N-T-E-R-V-I-N, representing Nevada Faculty Alliance, the independent association of NC faculty statewide. We work to empower faculty to be fully engaged in our mission to help students succeed. I also ditto the previous comments from Priscilla Maloney and from faculty at NC. Like other state employees, NC faculty rely on the Public Employees Benefits Program for our health care and other benefits, which are essential for keeping the workforce productive and for recruitment and retention. The PEB budget proposal in GovRec sharply increases deductibles and out-of-pocket maximums for the base plans, which mostly affect those who have serious chronic conditions or who have major medical events during the year. My written comments have additional details. The most egregious cut is the complete elimination of the long-term disability insurance. LTD insurance provides a portion of income for an employee who becomes disabled and cannot work. State employees are not covered by Social Security disability. Without the LTD benefit, disabled employees will have no income, and once they have depleted any personal savings, will become dependent on Medicaid and social services, and that makes it more unlikely that they will be able to return to work after rehabilitation. The cost to PEB of the group LTD insurance is around $15 per employee per month. The cost on the individual LTD insurance market is $50 to $100 per month. That is unaffordable for most state employees, and PEB says they can't even provide a voluntary product in the next year. The proposed cuts put most of the cost on the most vulnerable, although we are appreciative that it keeps employee premiums relatively flat. It affects most and puts the cost on those with serious health conditions and those who become disabled. We respectfully request that the legislature, early in the session, restore the long-term disability insurance benefit and reduce the out-of-pocket maximums. Because the governor's budget has included these specific benefit cuts and eliminated LTD insurance against the recommendation of the PEB board, it is now up to the legislature to fix this. Time is pressing because PEB plan design for the coming year is already going into rate calculations that are finalized in March for open enrollment starting May 1st. On another note, the GFO's predicted trends for medical costs on page 9 of today's presentation by PEB are significantly lower than those of the independent actuary, which you should ask about, and that means that the basic insurance is also underfunded. Thank you very much for your attention to these matters.
Caller with the last three digits of 404. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good morning. Can you hear me?
Yes.
Good morning. My name is Kevin Rampt, R-A-N-F-T, representing AFSCME Local 4041, classified employees. Good morning again, everyone. Respected Chair and Committee, we would like to make it quick and short. We respectfully agree with all the testimony this morning from Dr. Unger, Dr. Irving, and Priscilla Maloney. We would just like to share our thoughts on PEB. We adamantly ask this committee to look at, during the session, restoring the rates, restoring the design plan. PEB has clearly had, some financial concerns overall, but really what we're looking at is the lives of state employees, ultimately looking at the debt of state employees and their families. This cannot endure during a time of COVID pandemic. We have to ensure that these state employees are protected as they are the frontline workers for the state. They fought hard during the COVID crisis and we're continuing to do so. We ask you to seriously look at restoring the losses that PEB is introducing today, ultimately during this legislative session. Thank you for your time. Bye.
For those that just joined, please press *9 now if you wish to speak. Chair, there are no more callers at this time.
Thank you very much. We appreciate that. So with that, committee members, we will go ahead and move forward with our first presentation today, which is the Public Employees Benefits Program. If we could go ahead and queue up the appropriate presenter, please.
Good morning, Chair and members of the subcommittee. For the record, I am Laura Rich, Executive Officer of the Public Employees Benefits Program. I also have with me today PEB's Chief Financial Officer, Carrie Eaton. Let me share my screen here so that we can begin. You guys see that?
Not yet.
Nope. Okay, let's see. How about that?
And not yet.
Working earlier. Let's see. It worked when we tried it this morning, so we're going to try it one more time. Let me close it.
And committee members, as Miss Rich is getting everything ready, I neglected to mention that as you have questions, we'll probably take them in chunks throughout this budget because it's a complicated one. But please just let me know through the chat function if you have any questions and I'll be happy to recognize you, okay? So, Ms. Rich, I think you're good.
Perfect. Okay. So today I will be going over a brief program overview as well as the various aspects of the governor's recommended budget. And then we're going to go into the decision units and finalize with priorities in PEB's performance-based budget. So what is it that PEB does? We manage a quality health program for over 72,000 members. 45,000 of them are primary participants with 27,000 covered dependents. Those are active employees, they are retirees, they're state employees or non-state employees as well. So we offer medical, pharmacy, vision, and dental coverages in a few different plans. We have a high deductible PPO, which we refer to as the CDHP, the Consumer Driven Health Plan. The statewide low deductible plan, which is coming in July 2021, we're very excited to introduce that. And then we have two regional plans, an EPO in the north and an HMO in the south. We also offer state and non-state Medicare retirees access to a national individual Medicare marketplace exchange for both Medicare Advantage and supplement plans. And then we offer a lot of different supplementary benefits, such as life insurance, short-term disability, long-term care, flexible spending accounts, and a variety of other supplemental insurance products. So during the last year, the program has made a series of policy changes that make the PEB health plan more aligned with how typical commercial health plans function. The board chose to implement more actuarially sound methodologies that will result in PEB's ability to better project utilization and costs for the program. So the first one was a decision to underwrite all plans into a single risk pool. Before, we'd been treating each plan separately and pricing it based on its own individual experience. So what that meant that when high cost members went from one plan to another, we call that migration, say the HMO, it puts that plan into a death spiral because each year that plan gets more and more, or actually less and less affordable. So the reality is that a PEB plan is a PEB plan. PEB is responsible for paying all of the claims on those plans, so we really shouldn't treat them separately. The second decision was to apply the state contribution equally regardless of plan. So in the past, we tended to favor the high deductible plan over some of the other plans. And so we applied a greater subsidy percentage to the CDHP over the other plans. So having to predict enrollment in each plan because of these differences in subsidy adds just another layer of projections that can be off, and they impact PEB's overall budget. Third, the decision was made to apply HSA and HRA funding to employees only. So if you recall, the HSA has always been provided as a base dollar amount to employees. And then additional funding is given based on the number of dependents that an employee would have. So again, this adds an additional layer of complexity where projections are being made on how many dependents we think will be covered under the CDHP, because the CDHP is the only plan that has that HSA contribution. And by applying that funding at the employee level, it just simplifies our projections and allows for more precise budgeting. Lastly, the decision was made to streamline tier factors. So in the past, PEB would depend on our actuaries, on our contracted independent actuaries, to produce overall rates for the plan. Up until that point, the pricing of the plan would use actuarially sound methodology. But then PEB would go on and add what we call the admin load, the administrative load, meaning all of those costs that are added on top of the plan utilization. So it's things like life insurance and long-term disability, and then all of the admin fees that we pay to our vendors. So that's what's loaded onto those overall rates. So we've always just lumped those onto that rate that the actuary gives us, which makes the actuaries twinge because all of that actuarial methodology at that point is really undone. So instead, the actuaries are now a lot more involved in that process of adding that admin load so that those loads are applied accurately and consistently on a per member per month basis. So you heard me talk about a new plan. Why are we introducing a new plan? The new low deductible plan is what we're calling it. So back when we were given initial budget direction earlier this year before COVID, we were told that we had to keep our budget flat. So for a flat budget for PEB, that is really approximately a 5% cut, because you have to take into account the medical and the increased medical and pharmacy costs. That's what we call trend. So a flat budget for us, it's the dollar doesn't go as far. So really it's 5% less for us. So we knew that we were going to have to make cuts just just at that point, and that was before COVID hit. We knew it was going to impact the current plan design and that the impact would be pretty significant, especially on that CDHP. The other reason was because we had been hearing from public comment and advocacy groups for many, many years that there was a strong desire to bring back a low deductible option. We have a high deductible plan that includes very low premiums, but you have a pretty significant out-of-pocket cost that you have to meet until the plan starts paying. The alternative to that is if you select the HMO or EPO, where you have pretty significant high monthly premiums, and then you have a copay-based plan beyond that. And so this is kind of that low deductible plan is a middle tier plan. It's something that it has not the high premiums of the EPO and HMO, but not the high first dollar deductibles and out-of-pocket costs that the consumer-driven high deductible plan has. So we're pretty excited about that, and we'll go into that in just a minute. We'll show you what that looks like. So this is the budgeted plan design changes for plan year 22 and 23, or fiscal year 22 and 23. In November, PEB was asked to produce a plan using 12% budget reserve requirements. And as you heard me say earlier, we were already starting with which was essentially a cut because of the flat budgets. So the task the board and staff faced in November was not an easy one. A 12% reduction in the PEB budget translates to pretty steep benefit cuts. And during a global pandemic, the last thing we wanted to do was create more access to care and challenges for our members. So the board made a series of very, very tough plan design changes that met the 12% budgetary requirements. And those were then provided to the Governor's Finance Office. Fortunately, the Governor's Finance Office, GFO, was able to find last minute additional funding and work with PEB to ensure the impact of state employees and retirees were lessened. So there was a desire to ensure first dollar medical coverage dollars were reinstated. So this means anything where a member would encounter out-of-pocket costs when seeking medical care, things like deductibles, copays, and the price of premiums. We didn't want to impact those we wanted to avoid impacting those as much as possible. Or I should say the Governor's Finance Office wanted to avoid impacting those as much as possible. So as you can see on the chart, those were dramatically lower compared to that 12% version PEB submitted in November. The new low deductible plan is truly a low deductible plan with a $500 deductible and very low copays. And the premiums, as you can see on the chart, are also expected to stay relatively flat. And because of the policy change, where now we are applying the same flat dollar contribution across all plans, the HMO and EPO plans those premiums are reduced. So in some ways, depending on the plan, members are actually less impacted by those first dollars to medical care than they are even with the current plans today. But in order to salvage the medical benefits and prioritize access to medical care, as you heard through public comment, PEB had to make some very significant sacrifices to other ancillary products offered by the program. So the first one was that life insurance had to be reduced. Right now we are at $25,000 for an active employee and $12,500 for a retiree. We had to reduce that to $15,000 and $7,500. There were also some reductions to the Medicare exchange contributions. Today, we provide those Medicare retirees with $13 per year of service, topping out at $260 at 20 years. And that is now reduced to $11 per year of service. Lastly, the long-term disability benefit was eliminated entirely. First of all, it came with a very hefty price tag of $5.6 million a year. And with only approximately 20 to 25 employees using that benefit each year, the decision was made to eliminate it. So as you heard again through public comment, PEB hopes to be able to add this as a voluntary product that employees can opt into through the PEB voluntary product platform. It's doubtful that we can make it happen this open enrollment, but likely that we can get it into place by next open enrollment. Also, while not the same benefit, I do want to state on the record that those employees who have PERS have access to a disability retirement, which would provide those who do become disabled access to a monthly benefit. Also, I do want to emphasize that those who are currently receiving the LTD benefit, we've got 100 and some odd people receiving the LTD benefit, they will not be affected and will continue receiving that long-term disability benefit moving forward. And finally, I do want to say that although this plan has been included in the governor's recommended budget, the PEB board must still approve it, and they are scheduled to meet this upcoming Thursday. So there were a few other budgeted plan design changes as well. We looked at out-of-network billed charges. We used to use fair health standards, and instead we are moving to negotiate all of those out-of-network billed charges instead by using a 140% of Medicare charges. This will likely save the program almost $2 million. Then we also implemented Smart 90 on the EPO and the low deductible copay plan. That was already on the CDHP. We are just implementing that Smart 90 prescription program onto the other two other two plans. And basically what that is, we narrow the network for pharmacy to include to basically have those 90-day prescriptions filled at those certain networks. Then we also implemented a 30-day Express Advantage prescription program. This is very similar to the Smart 90. We narrowed the network. Instead of for 90-day maintenance medications, now this is also for 30-day prescriptions as well. So we narrowed that pharmacy network for those prescriptions as well, which also saves the plan a significant amount. And then you heard about the last three on this as well. So slide 8, you will see that these are our enrollment projections. Our enrollment projections for the next biennium are slightly lower due to hiring freezes and position eliminations. And the governor's recommended inflation assumptions, as you heard through public comment. Yeah, it's important to note here that PEB receives suggested trend from our independent actuaries based on PEB's unique utilization and cost. And historically, the state has applied universal medical trend, and the differences between PEB's trend and the national trend can and does have budgetary impacts. Variables. We have a lot of variables in the PEB program right now that are likely to impact PEB. First, we have a lot of contracts that are expiring. Unfortunately, a lot of these contracts, when I was appointed the executive officer, I found out they were all aligned to end at the same time. And so PEB has been undergoing a very, very significant undertaking of RFPs. So in fiscal year 22, we have the in-state medical network. This is a very, very large contract, and this is where Most of our budget is claims, and this is where you're going to see claims cost in that in-state medical network. So changes to that will impact the program significantly. Then we have the dental network, the HMO, and financial auditor, health plan auditor, and our benefits management system. So that's our enrollment and eligibility system. And then in 23, we have very, very large contracts that we'll be renewing, and that is our third-party administrator, the National Medical Network. So that is also through, so we just did the in-state medical network. Now we also have a national network that those members that use the plan outside of the state use. Again, this is very significant for claims cost. Then you have the dental claims administrator, the PBM, which is our pharmacy benefits manager, and we have basic life insurance and long-term disability. On top of that, we have claims. So COVID has impacted everything, it seems like, but certainly our health plan. COVID-19 claims cost, the medical cost, the vaccine cost. So the vaccine is free, but there's administrative fees. There are administrative fees that are associated with that vaccine. So each vaccine comes with about a $25 admin fee that is charged to the plan. Then there's those plan design changes. You have heard me talk about the new plan design. There's always unknown utilization and migration when you introduce a new plan. And then medical and pharmacy trend. We don't know, will we be heavily impacted by COVID? Will that continue? Is there going to be, we've had some claim suppression this last year from people not going to the doctor because everything has been shut down. Is that going to continue? Is that, there's a lot of unknowns there. So unfortunately, there are a lot of variables that will impact our budget. This is the governor's recommended budget, which includes active employee group insurance subsidy or AGES. The assessment is of $727 for FY22, which is a 7% decrease over FY21, and $755 for FY23, which is a 4% decrease over FY21. The retired group insurance subsidy or REGI assessment is $471 for FY22, which is a 4% decrease over FY21, and $498 for 23, which is a 4% increase over FY21. The base Medicare exchange health reimbursement arrangement decreases from $195 in 21 to $165 in 22, and FY23 as a base subsidy for a 15-year retiree. The Medicare exchange health reimbursement arrangement is provided currently at $13, and you heard me say that that is now decreasing to $11 per month per year of service in fiscal year 22 and 23. So moving on to the reserves history. The health reimbursement account or health reimbursement arrangement, reserve was previously funded at 100% of the CDHP HRA unspent balance for active employees and pre-Medicare retirees, and any unspent balances for the Medicare exchange HRA members to ensure funding is available to cover all available HRA balances in those accounts. But the PEB board voted to fund the HRA reserve at 80% beginning in FY21. And that was done really to free up some reserves for FY21 budget reserves. So IBNR reserves, incurred but not realized reserves, are for incurred but not paid claims, which happens when participants seek service and a claim has not yet been filed or paid. The providers and participants have a year from the date of service to file a claim. That reserve has been fully funded at a 95% probability and will cover all the claims submitted for that plan year as determined by PEB's contracted actuary. And then we have catastrophic reserves. The board did vote to reduce the catastrophic reserve levels to a 50 days of claims payment on hand beginning in FY21. Again, that was done to free up some cash for the first round of reserves that we had to come up with. Then finally, differential cash available, or what you've heard as is excess reserves, are made up of increased revenue and or reduced spending. So that differential cash available has fluctuated over the years. However, PEB has been focused on attempting to ensure that those reserve levels continue to remain at feasible levels. So let me go on to the next slide shows further detail on PEB's reserves. The actuarial analysis of the IBNR and catastrophic reserves are completed on an annual basis and may increase or decrease depending on the time, number, and level of claims being paid, and utilizes actuarial analysis to project IBNR and catastrophic reserves. The governor's recommended budget for PEB is $1 billion over the biennium. $1 billion over the biennium. Of that, 55% of the revenue is funded by the state subsidy. The second largest source of revenue is 24% carry forward. Employee and retiree contributions make up the 14% of that revenue, and non-state subsidies contribute 4%. All other income makes up the remaining 3%, which includes miscellaneous income, RDS subsidies, prescription rebates, and treasurer's interest. So expenditures, 55% of PEB's expenditures are projected to be expended on self-funded plan claims. The second largest expenditure is 24% for PEB's 4 reserve categories. And then our fully insured expenditures, such as our HMO and life insurance premiums, make up 9%. Contributions to the health savings arrangements and health savings accounts and health reimbursement arrangements make up 8%. And then their self-funded admin costs are 3%, and PEB's operating budget makes up the remaining 1%. So the next slide shows the maintenance units included in the governor's recommended budget. Enrollment changes in medical prescription and dental inflation changes are the most notable here. And then the enhancement units. There are 2 small enhancement units that were included in the governor's recommended budget. The decision unit E225 requests a small amount of funding for 5 additional Adobe Acrobat Pro software licenses and 2 additional Adobe Creative Cloud applications. And then decision unit E710 includes routine replacement of computer equipment to be funded by excess reserves. There have been really no significant changes to PEB's performance measures. Our measures include expense ratio, claims loss ratio, generic drug utilization, medical and dental network utilization, and appeals ratios. PEB also measures participants in our diabetes care management program, and then also in the obesity care management program, as well as our preventive dental and office visits. So with that, I will stop here and take any questions that the committee may have.
Thank you very much, Ms. Rich. Health insurance is always complicated. And I want to thank you. You did an excellent job in front of the Interim Retirements and Benefits Committee and trying to walk us through all the changes that were proposed there. And I noticed there's a couple variations on that in the governor's recommended budget. I think what I'd like to ask is, since you have a new plan, if we could go ahead and go over that first, so that folks have a familiarity with that, the low deductible health plan. And I do have a couple of questions on that. If you could go ahead and pull that one back up.
I sure can. Let's see. So let me go
And
back.
I remember in the interim retirements and benefits committee, I had a number of questions because I was a little confused about what actually went towards even though it's a low deductible, not every copay gets applied to the deductible. So if you could expand on that, even though it is a lower deductible, how do people meet the deductible?
Sure. So I think, can you see the screen?
Kinda.
Okay, let me see if I can zoom in a little bit here.
Oh, going the wrong way. There we go. Okay.
Oh, wrong way there. Okay, hang on. Okay, is that a little better there?
Yes, that's a bit better. Thank you.
Okay. So the new low deductible plan is that one you see in green in the middle. So you have to, in order to have 3 options, you have to kind of spread them out a little bit. You can't have 3 of the same types of plans. And so you have to spread them out a little bit. And you do that by applying what the actuaries call actuarial value. So in the low deductible plan, you can see here that the deductible is $500 for an individual or $1,000 for the family. And we call it a low deductible plan, but really most of it is based on copays. So if you go to the doctor, let's say you want to visit your primary care doctor, you're looking at a $30 copay. That deductible is irrelevant at that point. You're paying $30 to go see a primary care doctor. You're paying $50 to go see a specialist. You're paying, if you end up at the ER, it's $750, and urgent care is $80. Then if you go down to your pharmacy costs, if you're looking at those generic drugs, a generic drug is going to cost $10. A prescription for a formulary is, so any kind of formulary drug that will be $40, and non-formulary is $75. So those are just copays. They're not going to go to the deductible. Those are payments that are applied as you go and you just pay a copay and you don't have to meet the deductible. However, if you have a hospital visit, let's say that you have surgery of some sort, or any of these all other services, you have imaging done. Those are things that are applied to that deductible, and so that you will have to meet the either $500 for an individual or $1,000 for and a family. So any of those costs will be applied to that deductible. Does that make sense?
And thank you. So just so that I can clarify, the deductibles that are at the top there, the one I'm most concerned about is the ER visit, that the copay is $750, but yet it does not apply towards your deductible. So a family could end up having 1 or 2 ER visits and end up spending $1,500, but not have those dollars apply towards their deductible and still have that $1,000 deductible hanging out there. So I guess I need to understand that a little bit more, and I don't want to slow us down because the subcommittee is going to dive into this, but I think what would be very helpful for the subcommittee and for other folks is if we could have sort of a little bit better breakdown on how this all comes together with some scenarios, because when you look at the graph, it almost looks like the 750 would go towards that, but with your explanation, it doesn't. So I'm just a little concerned that folks will think that they're getting a better deal with the $1,000, but ultimately the cost of their copays could end up costing them a lot more, and they're paying more per month than the high deductible plan and the HMO. So I don't want to dig too deep into this because I know I've got a whole list of folks who'd like to ask you other questions. I just wanted to make sure that we had a little deeper explanation on this low deductible health plan.
Yes,
So
and like you said, Chair Carlton, we are working on a very detailed training and benefit guide to produce to be able to give to members as we move into open enrollment. So this is something that, typically during we like to put on open enrollment presentations every year. Unfortunately, due to COVID, we are not doing them in person. We're doing them over a webinar. But this is something that we would focus have a lot of attention on in those presentations so that members understand completely what they are selecting when they choose an option.
thank you very much. I appreciate that. I'm going to go ahead and go to some questions. Ms. Howdigi, did you have a question from earlier?
I did. Thank you so much, Chair. And my question was regarding the health savings account. And I think I know the answer, but I want to put it on the record. I want to be sure. I understand that the contributions will now be made for the employee only, but those contributions of, I think it was $600 in the governor's recommended budget, can still be used for any covered family member, correct? Not just for the employee.
You are correct, yes.
Thank you.
Okay, thank you, Ms. Howdigi. Ms. Miller, you had a question?
Sure, thank you, Chair. I just wanted to clarify, and maybe I heard it wrong, or maybe it was just a quick misspeak, but you made a statement earlier about the long-term benefits, about those that were in PERS have access to it, and it just sounded a little strange because we know that all of our public employees are in PERS. So did you mean those in PEB or those actually receiving their PERS pension? Can you just clarify, just so that we're all clear on the record?
Correct. So the disability retirement benefit offered through PERS is not, it's not a long-term disability. It's not the same benefits. I do want to clarify that it's not the same benefit. It's another option that those who participate in PERS do have access to. However, there is a small portion or percentage of the population that does not participate in PERS. Those are mainly the system of higher education faculty. They do not participate in PERS. They have a different retirement option. And so they would not have access to the PERS disability retirement should they become disabled.
Chair, follow-up question, please.
Yes, please, go ahead.
So you're referring to the actual disability, the benefit provided through PERS, where I just also want to clarify, we're not talking about additional, because I know we can purchase additional products as individuals in addition to what PERS and PEB is providing. So, but you're talking about the stuff actually provided through PERS for people in PERS.
Correct. It's a different benefit. Yes.
Okay. Thank you so much.
Thank you, Assemblywoman. I believe we can go to Dr. Titus next.
Thank you, Madam Chair. I appreciate the question. Thank you. This is always an interesting discussion and somewhat difficult to understand first blush. So on slide number 10, you mentioned several times access to care and some of these plans that you're renegotiating and these things coming up right now. Under our notes, we have that you have now this hybrid exclusive provider organization, or EPO, which is a relatively new term. And there was some concerns, I know, about access to care in the rural areas. And in Washoe County, you had the PPO in Clark and in Nye, but not throughout the rest of the state. And so I just want to get a little more detailed about the continuity of care and the access to care throughout our state. And are you looking at having the same care? We have a discussion many times that we want to make sure that there's equality throughout our state, that folks that have worked for the state in Elko or folks that work for the state in Washoe shouldn't get any different care than folks in Clark County, Nye, or any of the counties. So are we looking at trying to make that more equitable with this access to care and providers? And so that's my first question. Then I have a couple more, if I might, Madam Chair.
So great question. Yes. So both the CDHP and the low deductible copay plan are going to be offered statewide. The CDHP is offered statewide today, and the low deductible, the new plan, will also be offered statewide moving forward. Then we have the EPO and the HMO, and like you said, we try to keep them equitable. And so the EPO is offered in the north, and the HMO is offered in the south. They're regional plans. So this is the way that, typically when you have an HMO, it's a regional plan that offers care in a specific region and only offers urgent and emergent care outside of that region. So you can't you can't, if you sign up for this plan, you cannot have a primary care doctor that is outside of that region. And that's just part of the way that the HMO functions. And so that HMO and EPO are regional plans, and some people prefer those regional plans. And so it is an option, but the other two plans, yes, are offered statewide and do offer that statewide service as far as regardless of where you are in the state or, in the nation, you have access to choose your preferred provider.
You mentioned, thank you for that. You mentioned renegotiating these plans, and a lot of the stuff is coming up at the same time, which is obviously unfortunate. You don't have any kind of a tier system to make sure we have that coverage. So when you're renegotiating these plans, are you looking at lowering the cost to the state? And do you have any idea? And I'm sure we'll see this in the subcommittee when we break this down, but let's talk about what that cost is. When you renegotiate these plans, I would assume that you're renegotiating what you're paying per enrollee.
So for the record, Laura Rich, we don't negotiate the plans because we are the payer. So the premiums that come in either through the employer, which is the state, or the employee, pay for the claims that are incurred by the members. So we are the insurance company. We don't negotiate the plans, with the exception of the HMO. That is a fully insured product that we do negotiate and are in the process of doing so as we speak. It'll be presented, that contract will be presented to the board on Thursday. But we do not negotiate the plans. What we do negotiate is the networks that we use. And so those networks, we lease those networks, and the networks have contracts with providers. So when we go out to bid for those networks, that is what we're looking at. What kind of coverage do the networks have, and what kind of cost and contracts do they have with the providers? And so again, that is another contract that is going to be presented to the board on Thursday. And that's for our statewide network. So that is what we negotiate, not the plans itself. Does that make sense?
Yes, it does. I understand self-funded versus when you contract out. So thank you for that clarification. And then when you are looking at these plans and you're looking at, again, back to access to care, are you making sure that you have providers that are on these plans in every county, so that somebody in White Pine County doesn't have to travel to Las Vegas, or someone in Fallon doesn't have to travel necessarily into Washoe County to be able to access the care? So is that one of the points that you require in order to have these contracts?
We do. We actually look at that very closely. Unfortunately, Nevada does not have the best options of providers, especially out in the rurals. And so there are definitely gaps in all of the networks that we lease. In some of the networks, you get maybe better mental health services in one county, but then you don't have access to another hospital in another county, or vice versa. And so those are always things that the evaluation committee weighs. We have our consultants look at that very, very carefully and do a gap analysis when those contracts come out, for bid. So it's definitely something we look at, but unfortunately, because of the provider shortage that we have in the state, especially in the rurals, there's always a give and take.
Great, and thank you for that. So when you don't have somebody in the rurals, when you negotiate this contract, if they have to go out of network, you would cover that, correct? If they don't have it accessible in their own community?
Right, so we have our third-party administrator work very, very closely with those kinds of individuals. And sometimes there are times where we would contract directly with a certain provider. And so that way that they can seek those services if necessary.
So final question, if I might, Madam Chair, sorry. On slide number 18, you talked about utilization. And you had the projected utilization in 2020, and then you had the actual utilization. Do you actually have those numbers, and truly was it still utilized at your projected thing at 95 point whatever % that was? Because it's been my impression that healthcare utilization dropped significantly during 2020, but your beneficiaries continue to access it at the level that you predicted?
No, so a lot of these are, so we did have claim suppression. We definitely did have claim suppression throughout, especially March through the end of the year. The problem is that before COVID hit, we were well ahead of the game. We were looking at numbers that were showing much higher trend than what we had budgeted for. And so we definitely saw claim suppression throughout the end of the year, which essentially saved us.
Great. That's what I was wondering. How much was the cover over? But basically, it was just basically neutral because you hadn't projected, you had under projected, and as it turned out, it all evened out. Is that what I'm hearing you say? Great. Okay. Thank you, Madam Chair, for all the questions, and thank you for your time.
Okay, thank you, Dr. Titus. So with that, we'll go ahead and go to Assemblyman Hafen.
Thank you, Madam Chair, and thank you for the presentation. I have a couple of questions, and they're in regards to subrogation clauses. And my first question is basic question is, do all of these plans have subrogation clauses?
Yes, thank you for the question. Yes, we actually have a subrogation firm that does this through our third-party administrator, and they pursue recoveries. It is in our master plan document. They do pursue subrogation claims. And I think PEB, I believe we're about at $1 million a year on subrogation claims, $1 million or maybe $1.2 million, if I remember correctly.
And my follow-up question is that $1 million, $1.2 million, where does that go? Does it go into the general fund? Is that going back into the PEB? Just curious where those funds go.
That does go back into the PEB plan, yes.
I appreciate it. And then one other thing, I know you guys said you were outsourcing the HMO. I'm assuming there'll be a subrogation clause with those. Would any of those funds end up back with you, or is it going to strictly stay with the insurance company that you guys end up going with?
So for our HMO, for the record, Laura Rich, for the HMO, we pay a strict per member per month for the HMO. So that would, if they do have subrogation, that stays within the HMO and does not come back to the PEB program.
Thank you. And thank you, Madam Chair.
You're welcome, Assemblyman. So with that, I'll go to Assemblywoman Tolles.
Thank you, Madam Chair. Can you hear me okay?
Yes, we can hear you.
Okay, thank you so much. Appreciate the presentation. I want to go back to page 10 on the slides and just confirm, and I was heartened to hear you say that we're going through an aggressive RFP process. I happened to be reviewing the audit reports for PEB and noted that our state auditors found that between fiscal years 2015 and 2019, PEB authorized nearly 96 million in contract services that were not competitively bid through the RFP process. And I know the reasoning was that they were relying on market checks, but that was only for one vendor, and that we found that we were paying more than other plans of similar size. So I just wanted to make sure that it was 100% clear that every single contract is going to go through that RFP process. We're no longer relying on that market watch practice that was put in place and ended up costing us more money from 2015 to 2019.
You're 100% correct. We are RFPing every single contract.
Wonderful, thank you. I appreciate that. And also I noticed that the auditors pointed out that there needed some greater oversight on some agency expenditures. For example, we used 620 hours to obtain business awards and accreditation. So has that practice been revised as well in terms of just ensuring better management of those funds?
So our board is actually addressing that as we speak. We have a subcommittee formed. They are addressing board policies and procedures to ensure greater oversight of the program. And that is also going to be presented to the full board on Thursday as well.
Wonderful, great, thank you. And I know our shared goal among all of us is just to make sure we're getting as many benefits to our employees as possible. So it's good that we save that money on the other side. Last question has to do with, in 2017, legislature passed SB 552, which is a 4-year phased-in approach to, as I understood it, essentially allocate more of the share to the local governments to help lower the monthly premium cost for non-state and non-Medicare retirees. And I wonder, do we know, as we're moving more towards 100% of that burden going to local governments, what those estimates are that the local and governments are going to have to incur over this biennium? And if you don't have that today, that's fine. If that's just something you could supply to the committee, I think that it would be helpful for us in just understanding how that share of allocation is going to impact local governments.
We can definitely provide that to the subcommittee for sure.
Great, thank you. Thank you, Madam Chair.
You're welcome, Assemblywoman Tolles, and I believe what you're referring to is the gradual shift to address the financial burden that was placed on what former Senator Smith coined as the orphans that were left in the middle of these plans to be able to address some of the issues. So we're on our way to finishing that. So we've done our due diligence on that one. I believe I have Assemblywoman Gorlow next.
Hi, thank you, Madam Chair. And I wanted to refer to slide 6 in the prescription drugs. I was wondering if you could give a little bit more elaboration on the difference between a formulary drug, a non-formulary drug, an RX specialty, and chronic illnesses that might fall under each of these categories. Concern, I work with a lot of children with special health care needs, and some of their medication, they have multiple medications that can run thousands of dollars. So I'm just kind of curious where someone like that might fall in the spectrum of different drug prices.
Sure. So a formulary drug, usually when we contract with a PBM, a pharmacy benefit manager, they typically come with or what they call a drug formulary. These are the drugs that they prefer, that they are getting at a much better cost. And so these are the drugs that are preferred for, whatever given any kind of prescription that is that a member would be given. So there's formulary and then there's non-formulary. So sometimes those drugs, certain drugs, don't work on certain people, and so then there's a preference of a non-formulary drug, and so that's the difference. Is there's certain individuals who prefer a non-formulary drug and will take that non-formulary drug, and so there's a price difference to that. Then there's also specialty. So specialty drugs are typically what you were referring to, those high cost drugs, those specialty drugs that usually go through not just the pharmacy benefit manager, but they have a specialty pharmacy that deals with those kinds of drugs specifically. I'm not a pharmacist, and so I don't want to speak on those. What I can do is provide the committee with some examples of what would fall under specialty and, the different costs and the different procedures that the PBM and the specialty pharmacy have to address some of these different high cost claims.
Thank you very much. And follow-up question, Chair?
Yes.
Thank you. Could you also talk a little bit more about how the prescription rebates work with some of those prescriptions? If they're going back to you guys versus the consumer, how does that play into it?
So the prescription rebates do come back directly to the PEB plan. We do get a very significant amount of prescription rebates, and I'm going to put Carrie on the spot here, Miss Eaton, our CFO. She might be able to correct me, but I believe in the last fiscal year we had about 9 or 10 million come back to the plan. Is that right, Miss Eaton?
This is Carrie Eaton. For prescription rebates, I believe we had almost 14 million come back to the plan.
So that goes back to the plan and it offsets claims. So essentially what it does is it does go back to the members in the form of rates, right? So that gets applied overall as a factor in rates.
Okay, thank you very much.
Okay. I believe those are all the members that I had in the queue to ask questions, but if there are any other members that have a question at this time, if you'd like to speak up or raise your hand to be recognized, or just speak up.
Madam Chair, may I ask a question about the long-term disability?
Yes, Ms. Monroe Moreno.
Thank you. And thank you for the presentation. I just wanted to make sure you had said that long-term disability that will be eliminated through recommendation, it will or it will not affect the number of retirees that are currently in the program. Will this just be for new retirees that will not have this as an option?
For the record, Laura Rich, this is not a retiree benefit. Long-term disability it only affects active employees. And you are correct. So those people that are receiving long-term disability will be, that are currently receiving that benefit are not affected whatsoever. It's only moving forward that benefit will not be available to anyone who may become disabled moving forward.
Will there be an option, a program that kind of like an AFLAC or something that employees could purchase, since this will not be a benefit moving forward for new employees?
Yes, PEB will be working on making that a voluntary option. We will work very hard to make it into this open enrollment, although I can't promise it. But definitely the next open enrollment, it will be an option.
Thank you, Madam Chair.
And thank you, Ms. Monroe Moreno. Ms. Rich, can you tell me approximately how many employees we have in the plan currently?
So primary employees, we have active employees. We have about 26,500.
And I'm sorry, I probably didn't state my question correctly. How many employees we have that are accessing the long-term disability benefit, who are currently using the long-term disability benefit?
So I can look that up. If you just give me a second, I can tell you it's 100 and actively 117 people are using the long-term disability benefit. Those 117 people will not be affected by the elimination of it.
I think the concern that I'm hearing is this gap year, because we have folks who may have been extremely ill this year, may not know if they're totally going to be coming back, but yet there won't be an option for them for another year. So I think what I'm hearing from folks is this donut hole of a concern that they may not have any options in the future. So I'm sure we're going to need to talk about that a little bit more and try to be strategic about how we make sure that those employees have some type of option out there to make sure that they're taken care of. So we can work on that when we get to the subcommittee level. I believe I have Senator Ratty next.
Thank you, Madam Chair. I think you were headed right down the path I was headed, which was concern about that gap year, particularly in the COVID-19 pandemic, and knowing that we have some folks who are experiencing longer term effects of COVID-19. So really just bottom line question, how much would it cost for us to extend the long-term insurance for one more year so that we could be absolutely certain that the alternative product was available and there wasn't a gap year?
The cost for long-term disability is about $4.6 million for each year. And that is to cover all active employees.
Great. Thank you.
Thank you, Senator. And Ms. Bedinas Thompson.
Thank you so much, Madam Chair. And once again, just for the interest of time, I'll put out 2 points that I'll be interested in discussing. I'm not on the subcommittee, but when we come back into the full committee, things that I'll be looking at. And so one, that'll be the conversation around medical inflation, because I know we spend in this committee so much time kind of guessing how much this is going to cost. And sometimes the number that we're looking at and that's coming from GovRec can be very different than what what you folks are seeing and being presented to on your board from your actuarials. So that medical inflation conversation. And then the second thing that I want to talk about is the carryover and understanding a little bit better about some of the reserves that we're carrying and the trend in those reserves. And so really happy to see that we're bringing down that excess reserve and spending that down, but the trends in the IBNRs from 2015 to now, we still have other ones kind of trending up, and would like to have a conversation about the rationale, and holding those and trending upwards on some of those other reserves, and then what plays into the carry forward that we have. Once again, not for now, but just for conversations as we move forward. Thanks.
Thank you, Ms. Bedinas Thompson. And I know in the IRBC committee, we've gone over this many, many times, and there have been a number of years that I've sat in the committee and they totally missed. So understanding that a little bit better would be very helpful. So with that, committee members, are there any other questions at this time on these particular items? Hearing none, thank you very much, Ms. Rich. This is very important to our state employees. I think I get more emails on this than I do just about anything else. So thank you very much for walking us through this, and we look forward to working with you more this session in getting these concerns addressed. So thank you. With that, committee members, I believe we can go to the next item on our agenda, which will be the Department of Public Safety.
Good morning. Can you hear me?
Good morning. Yes, Ms. Bridgerman.
Yes. I know Director Togliatti had some opening remarks. I'm wondering if he's had a chance to get his mic up and running. I think Mr. Malesko was working on that for him.
Yes, can you hear me?
Yes, thank you.
Yes, Director. Nice to see you. Please proceed.
Okay, thank you. Good morning, Madam Chair. I want to thank you for the opportunity to present our 21-23 biennium budget. These have certainly been some challenging times, and I think my team understands that quite well, and we have prepared this presentation with the thought of having to do more with less, but knowing that the need is still there, particularly in the environment that we're presently involved in. I want to particularly thank my deputy director, Sherry Bergerman, and also Curtis Palmer, who's our senior fiscal officer, and Kim Smith, who's our PIO, to put this presentation together, but the entire team was involved, and they are also available for any questions that you may have. So with that, I will turn it over to my deputy director, Sherry. Go through.
I'm going to have to remember the unmute part. Thank you. For the record, this is Sherry Brigham, Deputy Director, and in front of you, you have our mission statement, our vision statement, and our motto. And knowing that you are probably going to be hurting for time, we will skim right through these, and at the end of the presentation or at any time during, please feel free to ask questions, and then we'll save the majority of the time for your use. So if you can go to the next slide, please, Kim. That is our organizational chart right now, and normally we'd be there with you and you'd see our bright shining faces, but unfortunately we're Zooming it today. So at least it gives you an idea of putting names to faces throughout the session this year. And going to the next slide, we've been working on a lot of things in spite of COVID. The recruitment and retention efforts, which I will speak to in a few minutes, the offender tracking system, and of course, emergency management's movement to the Office of the Military. Our CCDs and CJIS modernization is moving right along, and we will speak to that later. And finally, our latest discovery is a state forensic laboratory information that we will present. Next slide, Kim, thank you. All righty, so we have been using our applicant tracking software and creating open house events so that we have all lines of positions, officers from cadets to colonels at them to answer questions. We have special relationship with the veterans and do veterans recruitment. We also have online background investigation software that allows us to get referrals a lot quicker than we used to be able to get and move them into the academy process faster. We still continue to attend career fairs inside of the state. And then we have done a tour of the state with regard to career fairs, even into the smaller cities and townships, because we figure one officer in our rules is better than no officers. So unfortunately, COVID has played its part in curtailing that a little earlier than we had hoped, but we will try again this year. And then our online content has definitely been updated and refined. Next slide, Kim. So due to our continued loss of officers, we have tried more and more options for recruiting, speeding up our processes, anything and everything we can possibly do to get more officers in and trained. So we adopted a career aptitude testing that we do at recruitment events. We also do it in between the recruitment events. It's often something that the applicant can access at home, and we allow for that as well. We do conditional offers much earlier in the process than we used to. And then we have gotten our recruiting events down to a science and have enough people at every center handling lines, handling calls, handling questions, doing physical testing, doing the career aptitude testing, and filling out backgrounds. Basically, we've also implemented a mentorship program where anyone has someone that they can talk to. And right now, our lieutenant in the training division has taken on the mentorship program and contacts each applicant, even while they're in the background process, to encourage them and to keep them moving along. Our new recruiting website is up and available, and I encourage you to take a look at it. We have videos from many of our academies. We have training videos for potential people who want to try out, but might be afraid of the physical requirements. There's a lot of information, including some FAQs that make it a little bit easier. And once again, when an outside person sends an email to this address, they get a response right away from our own Mike. So that's been wonderful. And then finally, because of COVID and a number of other things, obviously the drain on our forces, we have weekly recruiting meetings that encompasses all of our positions in these areas so that we can talk about whatever is blocking us this week, what we might do better next week, what we can count on, what we can't count on. Obviously, new COVID restrictions will restrict us from physical testing for a while. So we will fall back on doing the aptitude testing and postponing physical testing until that's feasible again. And so that has been working pretty well, considering the loss we expected from our applicants. Next slide, Kim. And finally, we're doing all this because of our turnover. As you can see, we have still more sworn leaving DPS as a whole than we can hire them. So we've been losing them faster than we can hire them for, well, the last 3 years. And we really want to change that aspect, and we're doing everything within our control to be able to do that. Obviously, we've talked about this a number of times, that the wages issue with compatible and like law enforcement agencies, the locals, our officers at least are 30% behind, simply because most of the larger local law enforcement agencies pays for the officer's share of PERS. So that's a huge, huge cost that our officers at the state have to pay. And with that, I'm going to turn this over to Curtis Palmer, our senior fiscal manager, who will go over all of our highlighted budget enhancements or changes. And then, of course, we'll take questions at any time. Thank you.
Thank you, Deputy
Mr.
Director.
Sorry. Oops. If I may
Right.
ask Ms. Burton, if you go back to the last slide, please. The turnover. And you're muted.
Thank you. Kim, are you working on that? Can you bring that slide up for me?
So I guess my question on the turnover is, how many are retirement? How many in highway patrol and how many in P&P?
First of all, the number one reason for people to leave is retirement. And so our most senior core is gone. We are developing new managers as we speak, but most of our folks that have left have been retired, and they move on to take secondary jobs where they find them. The second most strongest reason why people are leaving is the pay differential, the parity with the law enforcement. With regard to whether we're leaving more sworn in highway patrol and PNP, it goes back and forth. PNP obviously loses some of the sworn staff to highway patrol and vice versa, although it usually goes more one way than the other. But now it's close to half and half. We've got hundreds of vacancies right now where PNP is having to freeze most of theirs. Highway patrol is not yet, but we still have quite a few vacancies to fill.
Okay, thank you. We'll ask for more definite numbers when we get into the final presentations. Mr. Roberts, do you have a question at this time?
Madam Chair, I was just going to ask regarding the numbers of vacancies, but that can wait for a later presentation.
We'll have details for you then.
Thank you. And Speaker Frierson, did you have a question at this time?
I did. Thank you, Madam Chair. And thank you for going over your efforts with respect to recruitment. We've heard before, and we know the frustration about the pay differential and benefit differential, and it's an ongoing frustration. It always has been, but we are sensitive to it. My question, though, you talked about recruitment, and I believe you talked about mentoring as well. Could you speak to what efforts, and I apologize if I glitched a couple of times if I missed it. Could you speak to efforts to address recruitment diversity, both for new hires as well as promotions?
I'm not muted, am I? I'm sorry. For the record, this is Sherry Brigham. Can you hear me? Good. All right. I honestly can say that we get the applications and there's no color associated with the applications when we get them. So getting someone through backgrounds, we have no idea what ethnicity or other than probably male and female, because we do speak to them, until, gosh, I can't even say. We would actually even have a potential offer for hire before we were aware of what that diversity might be, because we're talking on the phone and the applications don't inquire, we don't inquire. So I don't believe we are doing anything in particular to mitigate any issue, because I don't think we've had an issue. We continue to hire just about anybody who is interested and qualified and are happy to do it.
Thank you, Madam Chair. I take up a lot of time here today, but along those lines, I think it would be helpful to know what, how diverse our department is, so that we can ascertain whether or not there is a challenge there or not. Because I do think that even I value not focusing on it when you're reviewing an application, but I also value recruitment efforts that would give you a diverse and rich pool to select from. So we can certainly talk about it as we move along, but I think it's something worthwhile to consider.
Right. Thank you, sir. And we are very interested in any ideas anyone would have. But yes, we can get the diversified numbers of our existing staff. And I believe some of our software does track applicants. So we might be able to get some information from that, and we'll have it for you. Thank you.
You're live. Madam Chair? Let it go. I think it's our tech.
Madam Chair, would you like me to continue?
I believe I have Dr. Titus for a brief question.
Thank you, and perhaps you'll be getting to this, and thank you, Madam Chair, for the question. I'm just interested in the your new positions that you have requested under the public safety and the Nevada Records of Criminal History. Is that going to be coming later this morning?
That's part of the next conversation, yes.
I'll hold my question
to them before they got to that, so yes. So Senator Ganser?
Thank you, Madam Chair. So I just wanted to follow up on what Speaker Frierson had asked about, which is the diversity. And I know there's different ways to recruit diverse populations. And you said you were open to ideas, but I was thinking maybe by the time you come to present, you can do some research with other organizations to see what they're doing to try to recruit folks who reflect the diversity of the communities that they're in. Because I don't think we have to reinvent the wheel. I think there's ways to do that. And I understand that it's difficult to recruit right now, but part of it is the messaging and what you're putting out and where you're putting it. So if you could do some research before the formal presentation, that would be great.
Mm-hmm.
Thank you.
Thank you. We'll be happy to do that.
Madam Chair?
Yes, Director?
Yeah, George Tagliati for the record. I just wanted to follow up with the last two comments. I know we've been researching a lot of opportunities to get more recruits. And the case in point is we are involved with some technical schools down here in Las Vegas. And what it comes down to is the bottom line is the competition for the best candidates. And that competition, as you can imagine, we're up against, particularly in Clark County, 3 or 4 major law enforcement agencies. They swoop right in on the qualified minority candidates as well. So they target them. We're side by side with them, but the competition is what's our biggest challenge right now.
Thank you, Director. So with that, let's go ahead and walk through the rest of the presentation. Mr. Palmer, I believe.
Yes, thank you.
Thank you, Chair Carlton and Deputy Director, for your presentation. And good morning, committee. My name is Curtis Palmer. I am the Senior Fiscal Officer of the ASO4 for the department. And Kim, if you could show our parole and probation slide. Thank you. So we'll do just a general overview of some of our major budgets and initiatives that are going forward in the governor's recommended budget. And we'll start with, excuse me, we'll start with parole and probation. Parole and probation uses caseload to help manage staff that are helping with the managing of parole and probationers. The caseload is adjusted biennially, primarily through M decision units. The governor's recommended budget this time around includes M201, M202, M204, and E225. And these decision units represent approximately $3.3 million in reduction to the general fund. I would note that the caseload projections are based and driven from the JFA reports, the James Austin reports, a contract that is managed by the Budget Office, I believe. And they provide 3 projections, one in the spring, one in the fall, and one in the winter. The projections the numbers and the projections used in the governor's recommended budget are from from the spring JFA reports. We do have a fall update, and the winter report will be coming available soon. The fall report does make some modifications and adjustments to the M decision units, and we'll talk about one of those in a moment. And of course, the budget preparation and presentation are massive in scale and numbers throughout the state. Not everything is as neat and tidy as one would like to have, and so there may be some minor adjustments, and we will be working with the Budget Office staff and LCB fiscal staff on making some of those adjustments as needed and providing information for them so decisions can be made. The fall JFA report did introduce an M203 decision unit, and so there may be need for an adjustment there. With the GO1 budget as presented for the governor's recommended budget, there will be some staff layoffs and reductions of 4 P&P Specialist 4s as currently represented and presented. And Kim, the next slide, please. In talking about a little more detail in M201 decision unit, there was an approved work study that was supposed to be conducted due to COVID. However, that work study was never completed or started and completed. Those funds were reverted for this fiscal year. However, the division did conduct its own internal study and focused on the capacity and the ability to perform their duties under existing and proposed caseloads. For the current model, it was discovered that the specialist supervisor's workload exceeds their capacity, and this lack of capacity requires that the specialist 4s and occasionally DPS lieutenants also assist in writing PSI reports in order to be able to comply with statutory guidelines. And next slide, please, Kim. One of the proposed models for the specialist 4 would be to no longer write PSI reports, except for exceptionally complicated or immediate court mandated reports. The study showed that the staffing specialist 4 in this manner creates the capacity to be able to read all the PSI reports and additional capacity remaining to perform the regular duties associated with managing people with teamwork duties and so forth. The specialist supervisor would perform as a true first line supervisor for the unit. Audit and review were performed by the specialist 4s and perform PSI review when court demand excess worker capacity. Staffing levels would remain at the current ratio of 1:8. And the next slide, Kim. This is describes some of the results of their study conducted internally. Kim, the next slide, please. For decision unit E225, this adjusts the caseload for low-risk offenders and creates a pod approach, which would be 2 DPS officers and 4 specialists, again, concerning the low-risk offenders, and be able to better manage staff and time. And the E350 provides funding to complete and maintain the Otis replacement software, the records management system, Of course, after years of delay and restarts, this project is finally seeing some light at the end of the tunnel, and funding in this regard is absolutely critical at this point to be able to finish the project as well as maintain the system in the future. Moving on to Highway Patrol, Decision Unit E225 is a revision to the uniform allowance through an implementation of a quartermaster type system. This is a zero cost implementation and is voluntary to participate by current staff. All new hires and transfers would be enrolled in the quartermaster system. Over time, the division anticipates savings through larger scale purchases and stronger position to negotiate better pricing. The immediate benefit would, of course, be a consistent appearance throughout the division, as well as increased morale. Kim, the next slide, please. The Division of Emergency Management has staff that's on call 24/7, 365 days a year to assist local and tribal authorities in response to emergencies. They also staff the Emergency Operations Center when a disaster or emergency threatens the state. Their work is completed prior to events, during events, and mop-up efforts after large-scale events. Division of Emergency Management is key to managing the state's liability and risk through planning and preparation in the advance of emergency or disaster. The division is over 95% federally funded and currently manages $2.26 million in federal funds. And the division continues to manage the 2017 flood for public assistance, as well as managing the needs for COVID during the current pandemic. Of particular note is the transition of the Division of Emergency Management from the DPS over to Office of Military, and this is being done to align state resources to better align with the Office of Military. And the next slide, please, Kim. Our next budget is the Records Communication and Compliance Division. The mission of Records Communication and Compliance is to provide accurate, timely, and appropriate public safety information to divisions within the department, the law enforcement community, and citizens of Nevada using state-of-the-art technology. Decision Unit E225 is the decision seeks to employ a program officer to one position to provide necessary coverage of services for over 2,000 users and 40 agencies statewide to provide an avenue for successful integration and training for the administration of the system. In Decision Unit E225, adding a PO1 will direct the task of training staff in the concealed carry weapon project away from supervisors and allowing them to focus on tracking law and legislative changes in personnel and program matters. E227 is adding two positions in the criminal records area to increase work due to increased workloads in all the program areas of criminal records. This is allowing staff which is not allowing staff to remain current in their disposition entries. So this is a needed add. E228, with the division's growth and programs, personnel and locations over the years, size and the class specifications in the fiscal unit remain the same and is incongruent with the responsibilities and oversight that it has gained. The division does not have adequate successful transition plan or backup for the ASO3 to assume any of those responsibilities. So the E355 adds an additional personnel in that area. In Decision E550, request funding of $9.3 million in each year of the biennium, and this continues funding the phased approach, replacing the insidious criminal justice information system modification. This replacement is a multi-year project and touches very sensitive systems involving many agencies throughout the state and nationwide criminal justice agencies. The governor's recommended budget for this biennium's, the governor's recommended budget is the second biennium of a 3-biennium project. For the state fire marshal's mission is to protect life, property, and the environment from fires, hazardous materials in the state of Nevada. Historically, the state fire marshal reverts fees collected back to the general fund. In this governor's recommended budget, this removes the general fund portion that has been traditionally given to the fire marshal as startup funds, except for $100 that would be used for contingency purposes. The division will now be self-funded and operate on their fees to fund their operations. Towards the end of this fiscal year, we will need to do a work program to modify funds normally being reverted to the state would then be balanced forward, and so there will be some adjustments to our budgets as we near the end of the year and into the next biennium to accommodate this change and transition to being fee-based. In Decision Unit E380, the new plans examiner, the agency currently has one plans examiner that has been budgeted, and so this additional position is needed. And next slide, please, Kim. And just briefly introducing and touching on a CFP project that the governor has put forward for a state lab. This recommendation includes programming and conceptual design for a state toxicology lab. The demand for toxicology analysis is substantial, and the legalization of recreational cannabis will continue to increase the prevalence of impaired driving. Additionally, the state must be able to demonstrate the ability to test and control cannabis substances to reduce liability for the state for poor quality and unsafe products. The state was able to secure some information on implementing and moving forward toward a state lab type concept. And I would like to turn the time over to Amy Davey for a moment to talk about this research that has been accomplished. Following Amy's presentation, I do have just 2 more budgets that we'll touch on briefly, and then we'll be wrapped up and open for questions. So at this point, Amy Davey, if you would take over. Amy is the Office of Traffic Safety Administrator and has been the driving force behind this research. So Amy.
Good morning, I'm here. I think I'm off mute. I don't know if you can see me or not. Thank you. Yes, I've been asked to just provide a introduction to the overview of this budget initiative on behalf of the Department of Public Safety. Nevada is one of only 2 U.S. states in the nation without a state-level forensic toxicology laboratory. Instead, the state utilizes 3 local jurisdiction public forensic toxicology laboratories and has been doing so really since we've needed these services. Nevada's assessment on this project was provided by the National Highway Traffic Safety Administration through a cooperative agreement with the Traffic Injury Research Foundation, which is an independent road safety research institute. They assembled a panel of scientists and toxicological laboratory experts to evaluate Nevada's existing environment and needs. And they've provided us with an extensive set of analyses and recommendations for implementation. Just so I don't forget, I will mention that the entire set of documents, the gap analysis, the implementation plan, and so forth, are located on the Office of Traffic Safety website under the impaired driving section on our website. The absence of a state laboratory is an impediment to understanding the magnitude of the impaired driving problem in Nevada. Similarly, the lack of standardized testing and data collection is a barrier to decision-making in terms of policy development and resource allocation. This problem has become more pronounced as a result of cannabis legalization. Moreover, without a state lab to conduct independent testing, it is challenging to enforce regulatory requirements related to cannabis production and sale. This new legal context and its resulting real-world implications have profound consequences for public safety. Standardized and high-quality data are the cornerstone of effective policies and programs to reduce road deaths and injuries resulting from alcohol and drug-impaired driving, and to provide fair and equitable adjudication of DUI traffic offenses. Nevada legislative bodies have convened subcommittees to study impaired driving issues, and you regularly hear testimony related to DUI laws. Further, the need to establish a state laboratory to undertake testing of biological samples is most recently underscored with the COVID-19 pandemic. Jurisdictions without a state toxicology lab jurisdictions with a state toxicology lab have been able to mobilize faster to execute a coordinated public health response. Continued contracted services with existing labs is not a sustainable strategy. Annually, Nevada sees between 12 and 13,000 DUI arrests. We have 300 fatal crashes annually in Nevada, 55% of which involve an impairing substance, 55%. And that number is not going down. The budget initiative, as Curtis mentions, is to begin programming and conceptual design. We understand this is a longer-term project that won't be completed in one biennium. And in fact, the department brought a proposal in, I believe it was 2007 or 2009 legislative session, a similar proposal. And unfortunately, the state was also experiencing some fiscal problems at that time. That concludes my remarks. Unless there are any questions at this time, Curtis, you can continue the presentation.
Thank you, Amy. Kim, the next slide, please. The Department of Public Safety also offers administrative support to two other agencies within the state. And the first one is the Board of Parole Commissioners. And so we're just speaking a little bit on their behalf. In Decision Unit E226 addresses their JFRE report that they receive as well, a $25,000 allowance for this study. A BDR has been submitted by the agency to modify the number of years between the comprehensive reviews to better match up with their data availabilities. And E357 is a request for court reporters and for the additional pardons hearing associated with SJR1. And the next slide, thank you, Kim. We also provide support to the Department of Sentencing Policy. It's a small department. They do not have fiscal staff, and so we offer our services to help them in that regard. It is a small lift, but on our part, but valuable to them. And with that, that concludes our prepared presentation. We're happy to entertain questions at this point. We have staff from all the different areas within the Department of Public Safety. So if we have not touched on something that you're interested in, we likely have staff available to help answer questions that you may have in that regard. So with that, we're happy to take your questions.
Okay, thank you very much, Mr. Palmer. So I'd like to go back, I believe it was slide 8. I hate to see the word layoffs in any of our presentations, especially when we're talking about all the vacancies and all the issues that are going on. So if you could expand upon what all these different specialists are. You had mentioned a number of different categories of specialists and how many of those positions are actually occupied. And is this a proposal to go back to what you guys called years ago? And I don't know if you still call it this, but the minimum bank as far as P&P goes?
Thank you, Chair Carlton, for the question. We'll bring up our Chief Tom Lawson for P&P to discuss that specifically. But yes, the 4 positions mentioned for layoff are filled positions at this time. So,
and they're field positions of?
They are specialist positions.
Okay.
And Chief Lawson, perhaps you could speak further to that detail.
Yes, good morning, Chair Carlton and members of the panel. My name is Tom Lawson. I'm the Chief of the Parole and Probation Division. And I will, excuse me while I look to the side here and bring up my vacancy report to answer some of your other questions, so I have that available. So first and foremost, under the the M201 unit, let me switch back over to that tab. The M201 unit that we're talking about with the projected layoffs. Again, as the note says in slide 8, that the Curtis Palmer mentioned is that there are multiple JFA projections throughout the year. At the initial budget building, we used the most recent ones, which was the spring of 2020, just prior to the submission of the cut projections or reduction projections. There were the fall numbers that came in, and those had some adjustments over the spring decision units. Unfortunately, like as mentioned here, that the spring units were, or the spring numbers were what was referenced in the current M201 unit. So we do see differences between the spring numbers and the fall numbers, and we anticipate also changes to the mid-session numbers that should come in. And my notes say that that final report should be submitted by JFA the 3rd week of March. And so typically there are adjustments mid-session to all of our maintenance units and a few of our enhancement units as those mid-session numbers come in, and we're anticipating changes in multiple units. And as Curtis Palmer mentioned, the addition of an M203 unit for Las Vegas civilians with that. So to your first question, Chair, about the difference between the levels, this MO201 unit deals with civilian staff, specifically in the pre-sentence investigation section of our operations. So dealing directly with the district courts on pre-sentence investigations. The different levels are the specialist 3, which are the primary PSI writers. Then we have the specialist 4, which under current methodology supplements and does some writing under the current caseload, as well as performs as a lead worker and a training officer. And the final level in that series for PSI writers, the PSI classifications or positions, is the specialist supervisor, who is tasked with currently reading all the PSIs that are written, as well as performing as the first line supervisor of those other staff members. So currently, as it is written using the spring numbers, 4 of the specialist 4 positions that are currently filled are slated to be cut, and that would result in the layoff of the incumbent employees. In the other slides that we've shown, talking about the results of our internal work study, because the external work study could not be completed as it was funded last session due to the COVID canceling travel right at the point where the outside vendor was slated to be on site performing the desk audits for us. That internal study show, if I have the slide here, that study shows that by simply shifting responsibility for reading the PSIs to the specialist 4s as opposed to the specialist supervisors, that creates capacity for the specialist supervisor to actually perform as a first line supervisor while retaining the capacity to complete all of our PSIs within our statutory timelines. About 3 sessions ago, that was a concern that was addressed with the PSI staff study for the specialist 3 positions. And since then, we have been over 90% compliant with the timelines of returning the PSIs to the court in a timely manner. And we'll be able to continue that with the adjusted caseload. As for current vacancies, Chair, we have in the specialist 3 category, and unfortunately, this report shows me statewide numbers. It does not break them down to the difference between PSI specialists and non-PSI specialists. But currently at the specialist 3 classification, we have 90 authorized positions with 30 vacant. And again, to qualify that, not all of those 30 are in the PSI assignment. Madam Chair, if I did not address any of your other questions, would you mind repeating the ones that I missed, please?
No, Chief Lawson, you've done pretty good here. My concerns is we've got trained personnel and vacancies, and I just want to make sure that I really don't nobody wants to see anybody laid off in this environment. If we've got someone who's a vetted employee and trained employee, I would hate to lose them in any way. And I'm glad you brought up the being able to be compliant with the court. I remember a number of years, the heated discussions about making sure that PSIs got to the court within a certain time frame, and we gave you the resources to do it. I don't want to go back down that road, lose qualified people, and find out we're not in compliance with what the court needs. So I hope that the subcommittee can dig deep into that and make sure that since we have trained folks, that there's some place for them to be. I just don't want to lose anyone as far as that goes. There's a number of other members who have some questions, so I'm going to go ahead and let them go, and then I'll play cleanup hitter later on. So with that, I believe I'd like to go to Speaker Frierson.
Thank you, Madam Chair. And this brief question, I recall at some point reviewing some pre-file bills, and one of which was proposed to get rid of the distinction between honorable and dishonorable discharges. Did I read that correctly? And do you think that's going to have an impact on workload or functioning of the department?
Good morning, Speaker Frierson. This is Tom Austin again for the record. Yes, sir, that is an executive bill draft that was submitted by DPS. I do not anticipate there to be a big impact on that. Over the years, the distinction between an honorable and dishonorable discharge has eroded with the restoration of civil rights through various bills over the past maybe 4 sessions or so, to the point now where honorable versus dishonorable is really just an adjective. Restoration of rights elements are there. There are people that are very compliant that, based on the definition in there now, don't receive an honorable discharge, and there are people that are non-compliant that meet the definition of an honorable discharge. So our thought is that by going to a general discharge and providing the information, for future charging decisions, for court consideration in the appropriate documents, as opposed to asking them to rely on just that one word descriptor, I think would be a better solution. And we've also had side conversations with the public defender's offices, the ACLU, as well as the prosecuting attorneys on this topic. And I'm sure there'll be some ongoing discussions before and during committee about that. But no, I don't anticipate there to be a huge change in that. And actually, what I wanted to mention also is that the changes to from AB 236 of last session actually helped create capacity for this new model, in that the PSI report became a little less complicated with the removal of the recommendation element, where the division no longer makes a recommendation to the sentencing court about the PSI, via the PSI, how the offender should be sentenced, or the convicted person should be sentenced. Now we just make a statement of fact in terms of what the statute requires, whether probation is eligible or not based on the offense, and what the minimum, the term range is that's available to the court. And so that simplification of the PSI helped create the capacity to allow the PSI writers, the specialist 3s, to complete that, all the writings, without the chipping in of the specialist 4s as they had in the past.
Thank you very much. And you remind me all the work that we've done over the years with respect to PSI writers and the backlog, and giving them the tools to be able to efficiently give the court the proper information. But when I said, will it have an impact, I was hoping that it would have a positive impact. In other words, a savings if fewer people, for example, are given I guess it wouldn't be a violation. It wouldn't be a revocation because they're still getting a discharge. But the hope, I think, similar to what you reflected on AB 236, is that this would also have a positive impact on bandwidth at the very least. But I guess that proof will be included. So thank you, Madam Chair.
You're welcome, Speaker. And Assemblyman Roberts, I'm sorry, I skipped over you. So I'll go to Assemblyman Roberts next.
Thank you, Madam Chair.
Too far down the screen, so go ahead.
That's okay. Thank you very much. And my question was regarding the lab. And, I know you got a phased in plan. At what point in your plan would you be able to actually process your own lab specimens for blood and fluids? What year is it? Would you be able to do it next year, or are you 2 years out? I'm just curious as to how long your implementation plan is to where you can actually stop sending or stop using the other labs in the state.
Thank you for the question. This is Curtis Palmer, the ASO4 for the department. There have been several discussions about this. Our hope and intent might be to have a temporary lab set up through a renting of some office space and so forth, which would allow us to get up to speed a little sooner once the lab has been approved and taken care of. Then we would be able to transition that over to a full lab setup and be able to move along more quickly in that sense. If that were the option that was taken up, I believe that we would have the ability to begin processing samples by the end of fiscal year 22 and more fully certainly in fiscal year 23. So it would be rather quick in that sense if we're able to do a rent office space and set up in that type of environment.
Thank you for that answer. And then one other follow-up, Madam Chair, on vacancies and vacancy savings, if I may.
Sure.
Just curious as to, so, you have hundreds of vacancies in the patrol and in various places in the organization. And at the end of the fiscal year, where do those savings go? Do you have the ability to come back and reprogram those funds? Do you carry them over? Just curious how you manage that. And excuse me if I should already know that, but I don't. So.
Thank you. Again, Curtis Palmer for the record. The vacancy savings and so forth that come through generally, and it depends on which pot of money and whether it's grant funded or different things of that nature. But the certainly general funded agencies, those funds are reverted if they're not used at the end of the year. The same with the highway fund, grant funds, for example, at the Office of Traffic Safety may be balanced forward depending on the nature of those funds and stipulations underlying them.
Thank you, and thank you, Madam Chair.
You're welcome, Mr. Roberts. And I believe I have Dr. Titus next.
Thank you, Madam Chair. I'm finally, I think, in the right budget here, budget component here. Under E225, you mentioned the 4 new positions in the central repository for the criminal records. Is that also associated then with the background checks?
Thank you, Dr. Titus, for the question. Curtis Palmer for the record. As far as, and let me make sure that I'm clear on the question, with respect to background reports or investigations for hiring staff, no, those would not be associated with that.
Okay. One of the big concerns we have is when we, the CCW classes, background checks for firearm permits, the gun shops, and they're mandated to do background checks. Who does that then? Because there's a huge backlog in those, and so this won't affect that.
Okay, so I was thinking background checks for hiring. On gun checks, let me defer over to RCCD, and Mindy McKay is the chief there, and she can explain further how those positions will be used. Mindy?
Yes, thank you so much. Can you hear me? Okay, wonderful.
Yes.
This is Mindy McKay. Thank you so much. This is Mindy McKay, Division Administrator, Records, Communications, and Compliance Division. To that question, the background checks for CCW permits goes through a different unit. This Program Officer 1 that you're referencing doesn't have anything to do with that unit.
All right, so are you looking at increasing the capacity so we can decrease the amount of time between these background checks?
Mindy McKay for the record. Staff are currently working on a plan to reduce the amount of time that it is taking to process the fingerprints for CCW permits.
Great, because I'm hearing from gun shop owners and the new bills that we passed mandate that it goes through them for this transfer of firearms, not just CCW. So we're looking at making sure that is decreasing. So we'll all be asking more questions when we get down to some of this subcommittees. Next question I had was on slide number 17, and we talk about the Spillman records, record keeping. Are all the law enforcement agencies in the states moving to Spillman now? And so can they communicate with each other?
Thank you again for the follow-up question. And again, we'll have to defer over to Mindy to answer that question.
No problem. This is Mindy McKay for the record. In regard to the current Spillman, we do have 40 plus agencies that utilize the Spillman system. There is not a plan to move all of the rest of the agencies in the state over to Spillman.
Because one of my reason I'm asking that is so that the able to communicate between agencies on some of these important issues that they do, that Spillman actually does do a good job at. So there's no, so only you got about, you said 40 agencies and the other 60, or is it 60 and 40 that aren't using it?
Mindy McKay for the record. Currently, there are 40 agencies that utilize Spillman. I'm not aware of an actual number for the remaining agencies that do not utilize Spillman. I can attempt to get that number for you, however.
Right, and I'm worried that there's a delay in information sharing with that. And then one more question on the lab, if I might, Chair Carlton. My question is, where are you anticipating the lab being located? I would assume Clark County would probably have the major bite of this, but that may not be true. And certainly we know in the rural areas, when I would do the work in the emergency room, and a highway patrolman officer would bring in somebody that they had brought in for me to evaluate, not just physically, but we'd have to run these drug tests on them also. We could do it in our particular lab, but if, we're talking 300 miles away to go to Las Vegas, and what are you looking at logistics that way? And are you looking at that $600,000 that you're budgeting to do the study? Is it going to be for a lab in Clark County?
Amy Davey with the Office of Traffic Safety. The assessment did identify 2 locations for the toxicology laboratory, and you're correct. One would be a Clark County location, and then one would be up here in the north, likely a Carson City or Washoe County location.
Do you know how long it takes you right now to get the information that you need? Is there a lag time? Because you're using local facilities to run your tests, and is there a lag time for you to get the results of that, especially in this COVID era?
Absolutely. One of the critical issues that we see is exactly what you're saying, that lag time. The 2 primary laboratories that are used by the state are the Washoe County Sheriff's Office laboratory and the Las Vegas Metro Police Department laboratory. They also service multiple other organizations and agencies. And they have different testing capabilities, different staff, different machinery, different protocols really for how they're doing the testing. So depending on where that sample is being sent, we have different delays, different lag time, and in fact, different types of testing and testing reports.
Right, and then you mentioned a little bit about the COVID impact, and one of the things that I have had folks from the Highway Patrol and our sheriff's departments reaching out to me and with questions is the breathalyzers, alcohol breathalyzers, and the concern regarding those tests and the exposure of the officers to potential COVID. I didn't see anything in the budget or any, where you got any CARES funds to maybe help with that and maybe change what you're doing as far as alcohol testing?
Thank you for the question. We did not receive any CARES funding for those particular items and operations.
And so did you apply for that? Because certainly there was some concerns about the contamination of those testing kits, et cetera, and there would be a cost. And I was just wondering if any of the CARES Act, and I'm hearing you say you didn't put in for any CARES Act supplements or funding for that.
Thank you, Curtis Palmer, for the record. No, we did not. The budget office guidelines on what could be and permitted to be projected in that manner did not include those areas.
Excuse me, this is, I'm sorry to interrupt, Curtis.
Sure.
I thought it might help if I clarified, and we have Jimmy Simpson online who can verify. But during the epidemic, the beginning of the pandemic, we ceased using those intoxilators, and we took the offender into the local areas to use the main one or got blood tests. Jimmy, can you expand on that for me?
Yes, we did do that. As soon as the COVID came out and our precautions were to keep the officers safe as well as the people within the jail, we stopped doing intoxilizer testing and did blood draws with warrants only. That was to safeguard everybody. Since then, we have eased up on that restriction. We do allow the use of the breathalyzer, but for many months we did cease that for the safety of all.
Great, thank you. And then one last question. Have you been able to get the vaccines, and has there been any delay? Are all of your folks that wanted the vaccine, have they been able to get the vaccine?
And is that for me here again?
Yes,
everybody who has wanted the vaccine has been able to get it. Not all of our troopers have signed up for that, and we are working on the tier 2 employees as well.
Well, thank you for the questions, Madam Chair. Thank you to all of you folks there keeping us safe, and I appreciate what you're doing.
With that, committee, are there any other questions? I don't have anyone else listed in the queue at this time. Seeing none, hearing none. Thank you all very much, Director and your team. We appreciate you being here today and presenting your information. And congratulations on your new Chief of the Highway Patrol. You picked a good one. So with that, we look forward to seeing you in Carson City at the subcommittee level to have further conversations. Thank you all very much today. So with that, committee, it is 11 o'clock, so we can move into our next item. And I plan on taking a break after this item, the Department of Motor Vehicles. So with that, broadcast services, if we could go ahead and queue up DMV.
Sure.
I believe I see Miss Butler.
I am here. Can you hear me?
We can hear you, yes.
Excellent. I have a presentation, and so let me see how good my skills are here with sharing that. Just give me just a second, if you would, please. Share. It's, if you'll bear with me for just a second, please.
That's fine. I'm not sure I could accomplish this, so.
Okay. Appreciate your
We're
indulgence.
very patient.
All right. Can you see that?
Not yet.
Mrs. Butler, this is broadcast. Would you like me to walk you through that?
Yeah, that would be super.
So if you look at the bottom of your screen, you'll see a little share screen button. Little green share screen.
Yeah,
button.
I got the green. Uh-huh.
Okay. Click on that. And then
Okay.
you're going to want to actually select your PowerPoint presentation. So not screen 1 and not screen 2, but you'll have a little section that says PowerPoint.
Okay.
Perfect.
You got it now?
Yep, you got it.
Super. Okay, great. So I will go ahead and get started. Thank you for the technical assist. Good morning, Madam Chair, members of the committee. For the record, I'm Julie Butler, Director of the Nevada Department of Motor Vehicles. With me today is Jude Heron, Deputy Director, and I am pleased to present an overview of the department's 22-23 budget. So the next slide talks about the department's vision, mission, and philosophy, which can be summed up in 7 words: identity, information, consumer protection, and public safety. The department is comprised of 7 divisions supported by the director's office. There are 1,267 authorized positions. Field services is our largest division and the division most commonly associated with the DMV. Central services is our second largest division, handling the department's back office operations. Compliance enforcement is a regulatory arm. Motor carrier collects fuel taxes on behalf of the entire state and registers commercial vehicles for intrastate and interstate use. Supporting divisions include administrative services, the motor vehicle IT division, and the Office of Project Management. The department's leadership team is displayed here and is with me today to answer any detailed questions that you might have. The department has 18 full-service office locations statewide and several partner locations throughout the state. The department is funded through highway fund appropriations, fees, transfers from internal budget accounts, cost allocations, reimbursements, and commissions. We receive an incredibly small general fund appropriation each fiscal year for the automatic voter registration program. Our highway fund appropriations must stay under 22% of the funds collected and distributed to the highway fund. That is a statutory cap and excludes fuel tax revenue. The 22% cap was increased to 27% for the last several fiscal years for our IT modernization efforts. So where does that money go? So that money, we historically collect about $1.5 billion in FY20, and those revenues go to various Nevada governments, approximately 39% being distributed to counties and school districts, approximately 36% being directed to the highway fund for the administration, improvement, maintenance, and construction of Nevada's highways. The DMV Blue Book is a financial document prepared by staff that shows the actual and anticipated amounts of highway fund and fee collections for the current biennium and upcoming biennium. Historically, the department updates the Blue Book to coincide with the executive budget process. Current Blue Book projections are based on FY21 actuals through November 15th, 2020. The Blue Book will be updated once more in fiscal year 21 and will form the funding basis for the legislatively approved budgets for the 22-23 biennium. So on slide 6, I mentioned that the department's highway fund appropriations are statutorily capped at 22% of the funds collected and distributed to the highway fund, excluding fuel tax revenues. The cap was increased to 27% in prior legislative sessions to account for the department's IT modernization efforts. In building the department's 22-23 budget, the department assumed a 27% cap would stay in effect. The department has submitted a bill draft request for this purpose. The other assumption was that starting on July 1st, the highway fund would keep 75% of the basic governmental services tax collected by the department after its commissions, and the general fund would get 25% of those BGST collections. This is consistent with legislation from the 2019 session. What this would mean is that more money is available to the highway fund for overall distribution to the departments that rely on this funding source. Under these assumptions, what this slide shows is that our department comes in under the 27% statutory cap. However, we also ran another scenario for informational purposes. Senate Bill 3 from the 31st special session temporarily requires 100% of the basic governmental services tax collections be directed to the general fund instead of the 25-75 split with the highway fund. If the 2021 legislature continued SB 3 into the next biennium, the result is approximately 62 million less highway funds over the biennium. And you can see the department would be over its statutory cap in fiscal year 23 by approximately 1.9 million. If this is the path that's taken by the 2021 legislature, we would need to discuss options to increase the cap or start looking at office closures to stay within that statutory limit. The COVID-19 pandemic and the resulting office closures have impacted the department's revenue collections for fiscal year 20. To mitigate, the department devised a method of identifying funds collected in fiscal year 21 and applying them to fiscal year 20. This has allowed the department to receive needed revenues for fiscal 20 while also providing more accurate actuals in fiscal year 21. After these adjustments, we see an overall decline in revenue of 3.92% in fiscal year 21 when compared with the same time period in fiscal year 20. Highway fund revenue shows a decline of 15.8%. However, if the highway fund were able to collect its 75% of basic governmental services tax, the overall reduction would only be 2.9%. This means the BGST accounts for nearly 13% of the overall 15.8% reduction in highway funds. Revenues will continue to be monitored and projections refined as the budget process continues. And now to service level impacts, which I'm sure you and your constituents and we are certainly very much aware of. The department continues to be affected by issues that are mostly related to the ongoing pandemic. The buildings are limited to 50% capacity. The effects of this are illustrated on this slide, where you see the number of customers served for the last 2 quarters of 2020 is roughly half of what it was for the same time period in 2019. The Las Vegas metro area is seeing on average 700 customers per day per location, but we're also seeing a nearly 50% no-show rate for appointments. This is a contributing factor to why appointments continue to be booked 90 days out and complicates things for individuals who need to conduct an in-person transaction. The department is doing its best to service the needs of the public while helping employees who must cope with distance learning for their children, COVID, and other family and health issues. Vacancies and normal annual and sick leave add to the challenges, as will furloughs required to be taken starting this month for the rest of the remainder of the fiscal year. The department offered overtime in the second half of 2020 with funding from the Federal CARES Act to help deal with staffing, but is no longer able to do so due to the CARES Act expiration and current budget constraints. And now to our budget request. In the previous slides, I spoke about the revenue impacts of the pandemic. This is translated into a reduction of 64 vacant positions department-wide. This is captured in the E605 decision unit in most budget accounts. Other cost-cutting measures to meet available projected revenues include only purchasing half of the needed replacement equipment in all budget accounts and foregoing printer maintenance for the next 2 years. To put this in perspective, the proposed cuts to staffing in order to meet available revenues mean we're looking at staffing levels below those from the 2008 recession. Meanwhile, by fiscal year 23, the population is projected to increase by over 500,000 people, or nearly 19% from fiscal year 2009 levels. The result is fewer staff to service the population, as you can see on the bottom of this chart. Other significant decision units include E729, the request for Office 365 licenses throughout the department as part of the Department of Administration's effort for standardization across the executive branch. E902 requests to transfer 27 vehicle appraisers and inspectors from the Field Services Division to the Compliance Enforcement Division, as duties of these positions better align with those of the Compliance Enforcement Division. There are various decision units within our Compliance Enforcement Division to properly equip our officers with necessary safety equipment. There are a few position upgrades in the motor vehicle IT budget account, which were approved by the Division of Human Resource Management last biennium, but were not included in the current budget. And finally, the records request budget account in the Central Services Division proposes to share the costs of a subscription to a records request tracking software with the Director's Office in Decision Unit E243. These charts illustrate how the department's budgets will be funded over the 22-23 biennium. Approximately 40% highway funds and 37% DMV fees, with the remainder consisting of various cost allocations and reimbursements. So how do we move forward? The staffing challenges coupled with the COVID-19 pandemic have spotlighted the need for the department to radically change its service delivery. No longer can we be a brick and mortar operation that happens to have a website for a few transactions. We need to be an online operation where customers only come into the office as the exception rather than the rule. It ought to be like any other online shopping experience where you add the service you need to your cart, you pay, and then you go about your life. The department's major budget initiative is focused on that transformation, but first I'd like to inform the committee about the department's progress in the current biennium. When I presented the department's system modernization budget, called STAR, to this body 2 years ago, I outlined 5 goals for the 2021 biennium. I'm happy to report that the department has followed through on those commitments. One of our biggest customer-facing improvements was the ability to offer driver's license and ID card renewals online. That took an emergency regulation change in computer programming, and the department went live with this functionality in September 2020. Since then, more than 51,000 Nevadans have renewed their driver's license or ID card online. The department is actively working internally and with its advertising agency to give our website an overhaul, with the goal of giving the public and our staff easy and intuitive access to the services and information the department provides. If people can readily find the information they need on our website, that will translate into fewer calls into our call center, fewer emails, and fewer office visits. Some changes have already taken place, with others scheduled for the conclusion by the end of fiscal year 21. Data cleansing is the process of removing duplicate data and consolidating records to prepare for a move from one system to another. Just like when you move houses, you go through your closets and your garbage and you take things to the dump. So you're not moving the garbage to your new home. We're doing the same thing here. The concept is that we're going through our data closets and deciding what records to keep and which to toss. Data cleansing has begun, and it will continue to the point at which our department is ready to migrate its data from our current system to our new solution. The largest project for the current biennium was an assessment of our current systems, an analysis of replacement alternatives, and the development of a plan, a roadmap, if you will, for how to replace those systems logically and responsibly over time. The DMV retained an expert in large and complex IT system replacements for this work, which was completed last summer. The roadmap recommends a series of 7 initiatives over 4 years to transform the DMV's business from custom developed software and into modern technologies that support the department's vision of customer service. At the same time, the roadmap recommends several operational and organizational structure changes to put customer service, rather than transactions, in the fore of everything that the department does. This is a new way of thinking about how we conduct our operations and will be a significant change for IT as well as for operations. We made other business changes to improve our operations. Some of those changes included combining our Management Services and Programs Division and our STAR staff to be our new Office of Project Management. The team was further expanded last August by adding the Application Support Group. These positions are staying in their respective budget accounts, but they combine to make a fantastic project management team with a consistent and holistic approach to managing the department's numerous business and IT projects. And finally, the Motor Carrier Division went live with its online international fuel tax and international registration system in September 2020. Benefits of the new system include 24/7 access for motor carriers needing to register and manage their fleets and file their fuel tax returns, single sign-on capability for carriers and staff, and the department's compliance with the Federal Motor Carrier Safety Administration's regulations. Compliance with these regulations means the department will continue to be eligible for FMCSA grant funding for future motor carrier-related projects and enhancements. And now for our major budget request, E550. The state of California went live with the virtual field office during the COVID-19 pandemic. Using software and platform as a service tools, they engaged a cloud services integrator and 2 other companies to put 9 of their most commonly used services online within a period of months. Their virtual field office sits on top of their antiquated mainframe application. In this way, changes are visible to the public, but they didn't have to undertake the bigger lift of replacing their entire mainframe. For the next biennium, our project steering committee has chosen to take a similar approach using the same vendors as the California DMV. The department will be adding new services to the virtual field office platform that we have identified as some of the key transactions our customers have needed during the shutdown and continue to need while our capacity is restricted to 50%. However, unlike California, our overarching goal is to transition all of our services online so that we never again have to find ourselves in this situation. Rather than these solutions sitting on top of the current mainframe, our plan is to replace the mainframe with these cloud-based solutions over the period of the next 4 years. For our customers, this approach will allow a person to complete any DMV transaction online that previously required an office visit, saving time and a trip to the DMV. Allow customers to upload necessary documents for transactions online. Complete and electronically sign DMV forms to include in the transaction. Have chat interactions with a DMV technician in English, Spanish, or Tagalog. Pay for the transaction once a DMV technician has reviewed and approved the documentation, and provide for a higher level of data security than exists today. For our DMV staff, taking this approach will allow staff to complete reviews and assist customers in a virtual system in addition to online, face-to-face transactions. It will provide ready access to a customer's information as opposed to searching in multiple systems and places as exists today. It will provide the ability to answer similar email questions from multiple customers at one time versus what they have to do today is one at a time, email after email after email. It will reduce complexity in adding new functionality when laws or regulations change. Following the initiatives as recommended in the roadmap, fiscal year 22 requests approximately $21.5 million to establish the virtual field office, obtain an integrated financial and accounting solution, and it also includes a customer relationship manager, which is a generic term for a system that helps a business manage its interactions with customers in order to transform our customer service experience. Fiscal year 23 requests $32.8 million to continue the efforts begun in fiscal year 22, working with our identified solution providers on the underlying architecture behind the scenes, further integrating the other initiatives from the roadmap, and continuing with data cleansing. The costs for the 22-23 biennium were based on the roadmap's high-level estimates for system replacements of similar scope and complexity. They're placeholders, if you will. Staff is currently working with our identified solution providers to refine those costs, and the department may be requesting some adjustments to the STAR budget account throughout the legislative phase of the budget. We have a lot of work ahead of us in preparation for our transformation effort. As part of its due diligence, staff has had several in-depth conversations with the California DMV and its solution providers to understand the capabilities of these cloud-based solutions. These providers are available through contracts the Nevada State Purchasing Division has already negotiated on behalf of all state agencies. Staff is actively working with these providers to refine the scope of work and cost for the life of the transformation project so that the department can join on to these contracts. In the meantime, the department is engaged with the contractor for advisory, change management, and consulting services to guide us through this massive transformation effort. Staff is documenting our current business processes in all areas and preparing staff for the changes that will be coming their way. Staff is actively researching financial solutions and seeking vendor demonstrations to find solutions that meet our needs, while continuing to analyze and prioritize transactions where we'll see the biggest bang for our buck if we put online. And finally, we're asking ourselves what we do well and where we can leverage existing and future vendors to streamline our businesses, our business processes. For example, we know that there are private drive schools out there that teach people how to drive, yet we still make people who have gone through these classes come to the department and take a drive test to be administered by one of the DMV's drive examiners. Why do we do that? As we've re-examined our processes throughout the pandemic, we've decided that that really is not efficient, and we've reached out to those drive schools and asked if they'd be willing to partner with us so that they could certify the individuals that go through those schools, and they wouldn't have to come in to the DMV to take their drive exam. We are pursuing the regulation changes to make that happen, and that's just one example. We also have a pending bill draft request with respect to the processing of salvage vehicle titles, which I'll discuss more in a moment. As I've mentioned, the department is continuing to look for opportunities to streamline its services for the benefit of the public as we move through the transformation project. Now I'd like to turn to a subject that's been of concern historically to this body, and that is merchant fees. As you all know, when you use your credit card, the business that accepts that card has the choice to pay the card's fee or pass along that fee to you as the consumer. It's no different for the state. When the DMV accepts credit cards from the public, it has two choices. It can pay the credit card companies their fees, or it can pass along those fees to the consumer. Historically, the department has chosen to pay the fees. The current biennium's budget authorized $8.8 million per fiscal year for merchant fees, with $3.3 million paid by highway fund appropriations. As the department encourages more and more online business, we're going to naturally see an increase in these merchant fees. We are projecting nearly $10 million in fiscal year 22 and $10.9 million in fiscal year 23. In the past, the department was able to offset merchant fees with the other fees that the department collects. Now, as we're playing catch up with the office closures, we're having to backfill more with highway funds, which is what you're seeing in our budget request. It's really a pretty simple formula. Less revenue coming in plus more online transactions equals higher merchant fees. This slide shows the number of credit and debit card transactions for the last 3 fiscal years. Fiscal year 2020 looks like fewer transactions, but it is understated due to our closures earlier in last year. The State Treasurer's Office is contracted with Wells Fargo on behalf of all state agencies to provide merchant services. If a card can be charged as debit, then it is charged as debit, regardless of what the consumer, what payment choice the consumer selects on their end. The department is currently paying an average of $6.13 per credit transaction and 48 cents per debit card transaction. The department looked into charging its customers a convenience fee rather than paying the merchant fee. Such convenience fees would cost consumers an additional 2 to 4% of their transactions cost. For your average vehicle registration of $232, this would result in an additional charge to the customer of $4.64 to $9.28. The higher the transactions cost, the higher the convenience fee. So besides taking a complete IT system overhaul and contracted programmers to accomplish charging a convenience fee, implementing such a fee, in the department's opinion, would be counterproductive. There would be those who would elect to come to an office and pay in cash just to avoid the additional 2 to 4% convenience charge, which is exactly the opposite of what we're trying to accomplish in moving to an online storefront, further contributing to delays in booking appointments, longer wait times, etc. I'd like to now highlight a couple of budget bills that you'll be seeing. We do anticipate a very active legislative session, and so the first budget bill that you'll be seeing is our division name change, and it includes a change of name for our Management Services and Program Division to the Office of Project Management. The name change better reflects the main duties of this division, which will combine employees to form a strong project management team for the department's multiple business and IT projects. This bill also includes a request to extend the $1 technology fee on all DMV transactions, which is a crucial part of our transformation effort. Having the technology fee allows the department to offset its highway fund request in order to maintain and upgrade its technology platforms. The bill maintains the current highway fund cap of 27%, which is crucial, as discussed earlier. The second bill concerns the off-highway vehicle trust account conversion. The department was given $500,000 in startup funds for the off-highway vehicle program in the 2009 legislative session. The department has completed implementation of this program, and what this bill does is transfer the remaining funds in this program to the Department of Conservation and Natural Resources for its use in maintaining the OHV program. We also have 3 policy bills which we look forward to presenting in the appropriate committees. SB 17 concerns drive schools. Currently, the department grants licenses for operation of driver training schools that have a physical location in Nevada, but online schools now exist, so students don't need to attend in person. What this bill does is removes the requirement that there be a physical location for a drive school in Nevada. The bill also clarifies that licensees' books and records be maintained and available to the department physically or electronically. As I mentioned previously, the pandemic has shown us that we need to re-examine which services we are providing in-house and which would make sense to offload. In this case, Senate Bill 29, salvage vehicle industry representatives have offered to partner with the department in the review and processing of salvage vehicle titles. The department has the authority to engage agents in other chapters of statutes, but not in the chapter dealing with junk and salvage vehicle titles. Industry representatives currently partner with other states in handling and processing salvage titles. Senate Bill 29 would allow third-party companies the ability to produce salvage titles in a manner similar to the authority granted in other statutes. And finally, Senate Bill 60 is a housekeeping measure concerning special license plates. Special plates approved in prior legislative sessions did not have consistent guidelines for plate design, development, specifications, and status changes. The proposed language in this bill will provide consistency for all proposed special license plates. Also, the department works with government agencies that need license plates that are similar to general issue for safety and security purposes, undercover plates. The department wants to clarify that these plates are issued to specific agency vehicles and are not transferable and not subject to reissue requirements. Also, changes made in the prior session in Assembly Bill 63 for the distribution of funds for first-time issuance of a license plate exempted from smog checks included language that increased the complexity of the distribution of these funds. The department seeks to reverse changes made last session and will work with legal staff to adopt regulations to ensure proper accounting and distribution of these funds. Finally, persons buying a vehicle from someone other than a dealer must purchase a temporary movement permit from the DMV before moving the vehicle. This creates a hardship when the sale is done outside of DMV operating hours. The department is recommending allowing a person to move a vehicle in these circumstances for a period of 3 days, which will allow the person time to obtain registration or a movement permit from the department. Lastly, I'd like to leave you with one highlight from 2020, which was the opening of the new Reno DMV and commercial driver license office in South Reno on November 2nd. The office features several improvements from the former location on Galletti Way and has the first in the nation drive-through kiosk for completing vehicle registration and printing plate decals and driver histories. So that concludes my presentation today. Staff and I stand ready to answer any questions you might have.
Thank you very much, Ms. Butler. There is a lot here. So with that, I believe we do have a couple of questions. I'd just like to start off with just thanking you and your staff. I know you've been through a lot in 2020, trying to figure out how to get everything done. And, you know, we in the nonprofit world were faced with an issue where we needed IDs for folks and current IDs, and yet you guys were closed. So thank you very much for working with folks as much as possible and helping us wherever we could to make sure that we could help all the folks that we're looking for assistance in the state. And I know your employees have been through a lot this past year. I'm just kind of curious. You know, you drive around and you see a lot of the temporary tags on the back. And some of them have some pretty far out dates before they're going to be turned into permanent tags. How long do you think it's going to take you to catch up? Because that's revenue that's driving around that we haven't captured yet.
That's a really good question. Thank you, Madam Chair. Julie Butler again for the record. Honestly, you know, that's why we stopped offering the extensions, is we are seeing the intent of that. The extensions that we offered was really to get people who have no choice but to come into an office to register their vehicle, like for instance, people that buy a vehicle from out of state, to be able to take advantage of that. And what we said consistently was, if you can renew those registrations online, we expect you to do so. What it has turned into in practice is people thinking they get just a holiday from paying their vehicle registrations. And you know, we're trying to change that mindset in the media that we put out and the information that we put online. It is taking a lot longer than we anticipated and a lot longer than we would like to see. And I guess maybe short of indicating to law enforcement to start pulling those people over now, and maybe that's what that's going to take. You know, I'm hoping that we will eventually catch up, but I can't give you a date.
Okay, I appreciate that, and we know a lot of us see it. So with that, I know there are some other questions from some folks. I believe sometimes the name doesn't come all the way through. So I think it's Assemblyman Levitt. Do you have a question?
I do. Thank you, Madam Chair. So with the, are you updating with this new online thing? How's the updating of the DMV emissions program going to work? And more specifically, are you going to require that all vehicles in Clark and Washoe be tested for NOx in this new format?
Thank you for the question, Assemblyman Levitt, Julie Butler for the record. We aren't, that hasn't been fleshed out just yet. So we will be conveying any changes to that as we go through the process.
Thank you.
Okay. Thank you, Assemblyman. I'll go to Vice Chair Brooks.
Thank you, Madam Chair. And thank you, Director, for presenting all this today. A lot of information. I have two questions, and my first one is, during this pandemic, it really impacted your operations in a significant way. And you mentioned that in-office visits were at 50% capacity, and then transactions were significantly down. Yet you'd mentioned that you also had overtime. Can you explain what that overtime was for, since you had less actual transactions taking place and less people in the offices?
Right. Thank you, Vice Chair Brooks, for that question. The overtime was primarily to process backlogs that had accrued in our mail-in programs in our Central Services Division. We also, several sessions ago, the department was given the authority to open and operate on Saturdays, yet the department was never staffed to fund a 6-day-a-week operation. And so we were using the overtime to help staff our Saturday operations. And, you might remember we had some significant pushes throughout the pandemic to get individuals who were new to Nevada registered to vote. And we held several traditionally before and after hours events where we were open. Traditionally our office hours have been 8 a.m. to 5 p.m., but we were opening, 7 a.m. to 6 p.m. To get new residents in so we could make sure that they were registered to vote, so we could take care of individuals who weren't able to register their vehicles online. So it's funded a number of things, mainly trying to get the public in and to get their business taken care of, whether that was behind the scenes in our Central Services Division or with our customer facing staff in our Field Services Division.
Thank you. And then if I may, Madam Chair, I had another question, separate subject. Excuse me, I'm messing with my mute button. I see that you've got some, really significant plans, and we've seen over the last couple of years for modernization and the transformation of the office, as you put it. And I think it's great. I think that that's what Nevadans need and want, and what we're used to getting in almost every service that we have on a daily basis now. And so I think it's a great idea. There's tens of millions of dollars being requested for that modernization. Is there any, have you made a correlation between reduced CIP asks in the future and less full-time employees needed in the future as a result of that automation?
Thank you for the question, Julie Butler, for the record. Perhaps down the road. We did, just for full transparency, we do have a CIP request pending, and that is for a study of architectural study to replace the Henderson office. And that if it made the cut, would be for consideration by the 2021 session. What we are finding is as soon as we reopened our doors to the public, we saw a drop in our online transactions. And so we are anticipating it's going to take a significant effort to re-educate the public to consume their DMV services online as opposed to going to an office. So in that respect, I don't think it will be an immediate need. You'll see an immediate transition from brick and mortar to online. And for that reason, the Henderson office has several deficiencies, mainly with respect to parking, and then just physical capacity in the building is just limited. And so that's why we did put in for a study for that. In terms of employees, I don't think you're going to see fewer employees, and here's why. When you go to online, it basically where it shifts the work is from the employees working the front counter to employees working in the back office. And so in order to be able to say, do chat transactions with our customers, to answer the phones with the phone questions that they have, to answer their emails and whatnot, you necessarily move from the front counter to the back office. And so I think what we're instead going to see is a shift from our counter personnel to our central services personnel.
I would have to imagine some efficiencies would come from automation, but I guess we'll see in future budget requests.
I think, and we will be documenting those efficiencies. Julie Butler again for the record. I think where we're really going to see efficiencies is in processing in timelines, and in reductions in things like postage and printer and those sorts of costs. Rather than people having to come in and wait for those things, I think you'll see those efficiencies there.
Thank you, Senator. I'll go to Dr. Titus next.
Thank you, Madam Chair. Ms. Butler, always appreciate hearing from you and what you're trying to do to speed up our DMV and access to that. So thank you. I have a couple questions. First on SB 29 and the salvage titles. I've had a number of folks as I live out in a rural area, represent a lot of rural Nevada. They've been reaching out to me about the issue of abandoned vehicles and cars and on public land. And part of it is the salvage titles themselves. Will this bill, and ultimately, obviously, we'll delve into the weeds of the bill, but I'm wondering about will that help with some of that, being able to get that moving, being able to move that vehicle and the salvage title to those vehicles?
Julie Butler for the record. No, that's not it. I mean, it might. The intent of that bill is really we have a backlog. Like as everybody knows, it's no secret. And we have a statutory timeframe by which to process these salvage titles. And so the bill, these industry representatives have indicated they can do that faster than we can. So it might help in that respect. And staff, Tanya Laney is on. It's actually her vehicle appraisers that actually help go out and work with local jurisdictions to remove abandoned vehicles in public lands. And Tanya, are you on? And can you speak to how we work with the locals to remove abandoned vehicles from those public lands?
Yes, good morning. This is Tanya Laney, Administrator of Field Services Division at the Nevada Department of Motor Vehicles, for the record. Through you, Madam Chair, to Dr. Titus. To answer your question, the DMV has to receive a request from someone to process that salvage title. So it either have to be the vehicle owner, or in the cases that you're speaking of where there's abandoned vehicles in the rural locations, we usually entertain those requests for a salvage title through local law enforcement or through the courts if they send DMV documentation on those vehicles that need to be removed off of the abandoned property.
One of the things that they brought up was that there's a cost to all of that. And nobody wants to spend any money. So is there a charge when they get these salvage titles?
Again, Tanya Laney for the record. Dr. Titus, thank you for the question. There is a minimal charge. I don't have that information in front of me, but the bigger issue is the research that goes behind trying to trace who the former owner of that vehicle is, to send out certified notifications to them, to try to attempt to make contact to make sure that the vehicle is in fact an abandoned vehicle and not owned, where a individual owner could be held liable. Where the costs typically come in is not on the DMV side for doing the research or issuing those titles. It's really on the tow companies. And so this was brought up in one of the former legislative sessions, where if they can't ever find a responsible party who owns that vehicle, or they've made attempt to contact with an owner of that vehicle on record, the tow companies end up eating the cost of that tow, or the city or the county or whatever local law enforcement is housing and storing that vehicle until the salvage process comes through, because they don't have anybody to go back and charge for the housing and towing of that vehicle.
Great, thank you. Hopefully we can find some way to solve that for sure. A couple other questions. We have had outside vendors help with some of this capacity issue. In the past, we've contracted with AAA, and someone could go down to the AAA office and get their registration. Are you still looking at using that type of services with this new modernization plan?
Thank you for the question, Julie Butler again for the record. Yes, we are. We still do have our partnership with AAA. We also partner with county assessors' offices to do some limited transactions in areas where there is not a field office. And we have periodic 3-4 times a year touch bases with AAA about those services, and continuing to build on that partnership. And we will continue to explore those types of opportunities.
And my next question is regarding these drivers. Sorry.
Oh, I'm sorry. We also are doing some kiosk expansions. We did put 3 new kiosks, or maybe 4, in the Las Vegas area recently. Also working with our vendor with those self-service kiosks to place those in more and more locations. They have to do a feasibility study for each of the locations where they place them. It's got to be profitable for them to be able to place a machine.
And then my next question is regarding these driver's tests. Not everybody that renews their driver's license or have to show competency with a driver's license have gone to a school. They don't teach driver ed in school anymore. And I'm just wondering about how that's going to work if you're not going to be offering the driver's skill test at your field offices.
Julie Butler again for the record, and I'm sorry if that was unclear during my testimony. We are going to continue to offer drive exams in a DMV office. What we're proposing is this is a supplement to that, because we know during the pandemic there have been a much greater demand for drive exams than I have staff and the capacity to fulfill right now. So we're looking to leverage where it makes sense. And in the case of these private drive schools, we've decided, it makes sense to use them as an additional resource. So if you can't get into DMV to take your drive exam, maybe you can get that exam through one of these private services, and that's what we're looking to do.
Excellent. And that would work for the motorcycle, that special application on your motorcycle driver's license that you've had, show some competency. So that would all be included in that?
No, that's a separate certification, and I believe they have to show certification through the Motorcycle Safety Foundation for that. Tanya, do you want to jump in on that, please?
Tanya Laney for the record, to you, Dr. Titus. That is correct. It would work similar in how the Motorcycle Safety Foundation does. And if one of these applicants go through a third-party drive school, they would bring us a certificate of completion for us to then issue the appropriate license to them, but it wouldn't change how we currently issue the motorcycle safety. They either come through the DMV or through the Motorcycle Safety Foundation to get that qualification to receive that license.
Great, thank you. And my next question is regarding the Spanish speakers that are applying for their licenses. We have a huge guest worker program in Mason Valley. Literally thousands of workers come in. None of them speak English. During those times, our little DMV office in Yarrington is flooded with folks trying to get their license. They need assistance with those applications to get their driver's license as a guest worker. And I'm just worried about how this online process, you said, I heard you say it's going to be in Spanish, or will you be able to, will these folks be able to access this as they need? I mean, there's long lines for them to get their driver's license. I just want to make sure that our Spanish-speaking population is not hindered by this going to online. I think it's critical that they be able to access this, and just want to make sure that we have those services available to them.
Thank you, Dr. Titus, for the question. Julie Butler again for the record. One of the really exciting things that we saw when we were meeting with the state of California about their virtual field office is that these cloud tools allow the capability for an individual to submit a question in Spanish, say. The technician on the other end can answer the person in English, but then it back translates to Spanish for the customer on the other end. And it's super exciting. We've seen it work. We've seen a demo ourselves, and this is capability that exists today and is capability that in the future we are really excited to roll out for the Spanish-speaking population.
Now, will they be able to do that for other languages too? I mean, we're such a multicultural state, and we just want to make sure that we're not just limiting it to those of us who our primary language is English, because I think having that availability is really critical.
Right. Thank you again, Julie Butler, for the record. So right now, California translates that, has a capability for like 13 or 14 languages, something like that. Current statute for the state of Nevada, based on population, is we're required for Spanish and Tagalog. But as those populations shift and as additional languages become more prevalent, that's something that the department could explore in the future.
Great. Thank you. And thank you for all you're doing. I appreciate your time. Thank you, Madam Chair.
Thank you.
You're welcome, Dr. Titus. And just I do have another member that has a question, but just because we're on the subject, having the driving schools actually do the test, what are the safeguards going to be put in there to make sure that, let's say the school doesn't say, oops, you didn't pass the test, you need to take 2 more lessons, or someone just being able to go in, pay the fee, get the paper that says they passed the test and turn it over to you. So what are the accountability measures that are going to be built in? Because I have to tell you, since we stopped doing driver's education, it's gotten a little.
Driver's ed in school. We had driver's ed in school.
Julie Butler again for the record. I'm going to punt this over to my deputy director who's been involved in this process. At a high level, I can say we're working on regulation changes so that we can work on regulating these industries. So I'm going to kick it over to Jude Heron to answer that directly.
Thank you.
Good morning. Good morning. My name is Jude Heron, Deputy Director for the Department of Motor Vehicles. I appreciate the question. I'm working with staff right now in the drive schools because of those kind of requirements that are needed to make sure that we have certain regulatory guidelines in place to where the department can monitor the efficiency of each drive school, making sure that the lesson plans and so forth are complied with. And as Tanya Laney indicated before, there's certain certifications that they would have to provide to us, and checks and balances, basically, without going into specifics, to make sure that they're complying with the drive tests in the same manner that the DMV would be, because they're basically an extension of the DMV and those regulations, and they are actually about halfway through our regulatory process right now.
Okay, and I appreciate that, but I'm a little uncomfortable with classifying them as an extension of the DMV when they're a private business and we don't regulate what they charge people. So we don't know what the cost is going to be to the constituent to be able to take these classes and get that driver's license. And if you don't have a driver's license in Southern Nevada, it's very difficult to succeed at work, school, all, sure, family life. So they are a private business, and I'm just concerned of what the cost will be to folks to be able to get that driver's license. So I hope that'll be taken into consideration.
It has been, and there's I believe, if my memory is correct, there's a reasonable cost that has to be associated, and it's a highly competitive company or business as well. So all the drive schools understand that they are not price gouging or anything to that effect. So it has to be a reasonable cost to the consumer.
Okay,
And
I just, yeah.
if the person can come into DMV in a reasonable amount of time and they pay a certain fee, the drive schools have to be very competitive with our fee as well. So.
Okay, I look forward to the conversations on this. Thank you very much. Appreciate the
Thank you.
answers.
Thank
So
you.
with that, I have, I believe, 2 more members. I believe I had Assemblyman Roberts next.
Thank you, Madam Chair. My question was asked and answered by a previous member, so thank you.
Oh, well, that's great. Thank you very much, Mr. Roberts. So with that, I believe I have Assemblyman Watts is next.
Thank you, Madam Chair. I have one question, and I know that you may not have the figures available, but going back to what Assemblywoman Titus was discussing with AAA, I'm just interested in how, you showed us how the pandemic has impacted the department's ability to provide services at their locations. I'd be interested in getting some more information on how that's affected the third-party services that interact with the DMV as well. So if you could just follow up at some point with some statistics on those volumes, that would be helpful. And then a little bit more of a statement, but just following up on some of the remarks that have already been provided in terms of modernization. I'm excited to see the direction that the department is heading on some of these initiatives. I really appreciate the statement of working to ensure that all transactions can be conducted online. I think that's the direction that we should be heading. And I just a couple of questions that again don't have to be answered right now, but are things that I'd be interested in learning more about as we continue to dig into these issues. And you've finished the kind of roadmap and plan is making sure that different customers are being reached out to about not only meeting the needs for the current services, but also looking towards the future. I know that there were some pieces of legislation proposed last session and ran into difficulties in figuring out how to make sure that those transactions could also be conducted online. So figuring out how a system is not only able to handle the current transactions that we're looking at, but has the ability to adapt and continue to provide efficiency as we learn about new kind of customer needs. And then also just thinking, I know that the department is looking at ensuring that we can maintain the motor voter work and communicating with the DMV, and just considering if there are other partnerships with other state agencies that may benefit from communication with the DMV and how a new IT solution can support that as well. So, and then the one last thing, I've brought this up with the department before, is thinking about back to what Chair Carlton was saying about the impact that not being able to obtain a license or register a vehicle can have, looking at options for folks to pay vehicle registration in installments to make those upfront fees more accessible to some of our lower income families. Would be interested in seeing what your analysis of options for that is moving forward. Thanks, Madam Chair.
Okay, you're welcome. Ms. Butler, did you have any comments in response or?
Thank you for that, Assemblyman Watts. Julie Butler again for the record. We can definitely get you additional information on the transactions that AAA has been conducting for the department. Definitely Motor Voters is an important one of our programs, and that will continue throughout. And in paying in installments, let me just address that briefly, but happy to have additional conversations. The department has been asked that question in the past and has done an analysis. The issue that you run into with that is once the person pays that first installment and they get the sticker, there's really no incentive for them to pay the other 3 quarterly payments. And so then it really does put a burden on my fiscal staff and our bad debt revenue recovery type staff to reach out then to those customers, and here's your next installment is due, and send them a bill, or it puts a lot of burden on the department to be able to offer that. So I guess I would submit, to the extent that that we do take credit cards and people are able to put their transaction on a credit card, and then they can pay whatever minimum payment that they are allowed to with their credit card provider. I mean, I think that's really practically the best that we can probably do, but we're certainly happy to share that analysis with you and with any of the other legislators who might have those, who might wonder about that.
Thank you, Director Butler. Very, very brief follow-up, Madam Chair.
Sure.
Thank you. I appreciate that. I would love to see that analysis. I know that there are some other states that have moved in this direction and worked on in terms of kind of public-private partnerships with other companies to handle some of those things. So would be interested in seeing what that analysis is and that what those options are. As you're looking, in other ways with driving school, for example, of expanding partnerships, this might be another one that could provide some relief to folks. Thank you, Madam Chair.
Thank you. Is there any other questions from any other committee members at this time? I don't think I see anyone else. So Ms. Butler, you and I share the same consternation when it comes to the credit card fees. I have tried to figure out how to crack that nut for, gosh, a long time. It really bothers me that, we're picking up the cost of those fees for the convenience of folks being able to do things online, and those dollars come from someplace else. So if we're not spending them at the DMV, we could possibly be spending them in other worthy areas. So if we can figure out a way to address this and not end up in 3 or 4 court battles, that would really be great, because those dollars are definitely needed in other areas of the state right now. So I look forward to your ideas and how you'd like to move forward with that and having those conversations. So with that, committee members, I don't think we have any other questions of Ms. Butler at this time. So it's always nice being the one right before lunch, Ms. Butler, because sometimes the hungriness takes over. So I'm sure you're going to be getting a lot more questions, and folks will be reaching out, and the members of the subcommittee will be reaching out to you also. So with that,
I look forward to it. Thank you.
Thank you, Ms. Butler. So with that, committee, I think we can go ahead and take a lunch break. I'd like to do 45 minutes. It's just a few minutes after noon right now. So if I could have everyone back at about 12:45 with your cameras on, that would be great. And we can proceed with the other presentations this afternoon. So we are in recess. Everyone enjoy your lunch.
Testing, testing.
Okay, if all members and staff could turn on your videos. And Chair, broadcast is ready. You may call the meeting to order.
Thank you so much. Thank you, committee. We will come out of recess and we will go to our next item today, which is the Department of Transportation. If I could go ahead and have the appropriate administrator queued up, please.
All right, can you all see me?
Yes, we can.
Great. Hi, I'm Christina Swallow. I'm the Director of the Nevada Department of Transportation. Thank you for having us for this presentation. I will share my screen. All right, I wanted to start with a budget, with an overview of the department, a real quick overview. So the Nevada Department of Transportation is responsible for planning, construction, operation, maintenance, design of approximately 14,000 lane miles of highway. Most of those are rural, 14% of them are urban, and 1,208 bridges. Those are both our bridges as well as local and federal bridges that we do not own. And while our system only is about 19% of all Nevada roads, our system carries 50% of all vehicle traffic, 70% of all truck traffic, and almost 70% of all heavy truck traffic. So it is critically important that we keep it in a state of good repair and that we continue to monitor its performance and its ability to meet the needs of all of Nevadans and those who visit us. I should also note that we are responsible for not just roadways, but we also support travel and cars, but also support travel by pedestrians, rail, bike, air, and of course, transit, including managing the majority of the federal funding for Nevada's rural transit programs, which offer over 5 million rides annually for the disabled, elderly, and others who may not have access to a vehicle. Our vision and mission are on the slide for you to see. I did want to talk briefly about our goals. You've seen these before, safety, environmental stewardship, efficient operations and maintenance, internal, external communications, organizational workforce development, and data management. And I wanted to just highlight a couple of these. In the last 2 years, our focus on environmental stewardship has really evolved beyond where we were a few years ago, where we were very focused on flora and fauna, and now we're in stormwater, and we're also today really focusing on our impact on greenhouse gas emissions and our ability to help the state achieve our climate goals. We have also started to evolve our transportation program itself so that we're really looking at how we efficiently operate the system, recognizing that resources are limited and we may not always be able to add additional capacity. We're really focusing on how do we maintain reliability and operate in a data smart manner, which leads me to the last goal, that consistent and effective data management is becoming more critically important as we advance as a society and as our vehicles advance as well. So we're really looking at how we can manage the data better to help us deliver a stronger, more reliable, and more sustainable program. I did also want to highlight on this slide, and I know there's a lot of information on it. We're engineers by nature, and we tend to put a lot on slides. But in federal fiscal year 2020 alone, our construction contracts alone, so not including any of the spending that we do on design or on planning or transit, just our construction contracts were estimated to create approximately 8,700 new jobs. And in the next biennium, our budget reflects approximately 14,000 job years. While we are overseen by a board of directors chaired by the governor, our organization is directly led by an executive leadership team. I have 3 deputy directors, one for operations and maintenance, one for planning and performance, and one for project delivery. We have 3 assistant directors and a communication and government relations director. We also critically have 3 district engineers that support our on-the-ground functionality across the state. We have over 1,800 permanent positions, and we use temporary and seasonal workers, including highway maintenance workers, con aides, and public service interns to help us deliver our program annually. I mentioned the 3 district engineers. The bold red dashed line shows the 3 districts, districts 1, 2, and 3, 1 being primarily in the southern part of the state, 2 being primarily western Nevada, and 3 being northeastern Nevada. Those are further subdivided into smaller areas. District 1 has 1 other major maintenance station outside of Las Vegas. It's in Tonopah. District 3's primary maintenance station is in Elko, but they have major maintenance stations as well in Winnemucca and Ely. You can see overall, we have maintenance stations across the entire state, enabling us to respond to anything that can happen on our network, which this past year, we definitely were challenged and were able to see how strong our response was when we had the largest earthquake in 60 years on 95 north of Tonopah, actually just outside of Mina, and a significant landslide in the very far northern reaches of the state, just there north of the Quinn River Station. So our team is across the state. They are certainly being tested today as this storm reaches all across the entire state. Wanted to highlight on our major projects that are some are currently ongoing and some are anticipated to start during this next biennium. So just noting that $1.3 billion number on the current slide reflects 3 years of projects. In Southern Nevada, we have the I-15-215 interchange, which is well underway in the northeast part of the valley. We anticipate in the coming biennium that we'll get started on the Tropicana interchange reconstruction and including the Harmon ramps. Some of the other projects that might be on here that you may be of interest in Southern Nevada, the Laughlin to Bullhead City Bridge, that $52 million, that is primarily led by Clark County, but it does include a longstanding federal earmark, and so we're excited to see that project finally come to fruition. In rural Nevada, we have several projects that are underway and anticipated. The Ely downtown reconstruction is currently underway. We have 5 maintenance projects across I-80 anticipated in 4 different counties. Some work on US 95 as well in a couple of locations. And in Northern Nevada, the Reno Spaghetti Bowl Express is already underway, and we're already seeing a lot of the construction impacts of that. It will continue and is anticipated to be on schedule. We're excited about that. State Route 445 Pyramid Highway will get started in this next biennium. Some work on US 50 up at the California-Nevada state line. We're excited to deliver that project. And then we are working on Mount Rose Highway and State Route 28 with some additional work. So large program in the works, and we're excited to deliver it. So our highway fund, we've heard a couple of presentations from other organizations, other departments that have access to the highway fund. And so I wanted to just give a high level overview of how the fund is funded. So on the left, you can see about a little over half of the fund is state user revenue. Then there's another just over a third that's federal aid. And then the DMV and DPS revenue, which we've seen already today, and then some other receipts. I should note that in that other receipts, it does include bonding. Oh, I should also highlight this reflects 2019 dollars because that is more reflective of a typical year. So we're looking back 2 years to see what a typical year would look like versus looking at fiscal year 2020. I should also note on the right that pie chart reflects the state user revenues. That roughly 50% on the left is broken out further in the right. And you can see that just over 50% of the state user revenue is fuel tax. So when you combine that with the federal aid, we're looking at just about half of our funding is ultimately fuel revenue, but then there's other fees in there, driver's license fees, motor carrier fees, vehicle and other registrations. And you can see on the right, federal FRI funding in fiscal year 2019 was $10 million. We've to date collected $27.5 million. I did mention bonding, and I just wanted to let you know, while we're not requesting bonding authority in this upcoming biennium, we were thankful to have it in the last one. We were able to sell a $100 million bond against our fuel tax revenue and a $60 million bond against our FRI revenue. The interest rates on those bonds were incredible. They came in at 1.56% for the larger $100 million bond and 1.75% for the FRI bond. So we were very fortunate and are looking forward to being able to expend those funds on both the SBX project up here in Reno, as well as the Tropicana project as that one gets along. And then the FRI funding will go to the final phase of the Centennial Bowl in Southern Nevada. So how is the funding in the highway fund distributed? You can see here that in fiscal 19, it was roughly $929 million was allocated to NDOT. The remainders were to DMV and to DPS, as well as some other disbursements, which included bond payments, some one-shot supplementals, a DMV buildings bond payment, et cetera. And I should also note, again, this is fiscal year 19. This was a little higher than typical because it did include some bond revenue. Typically, our annual basis revenues are closer to $800 million. All right, so this slide reflects the highway fund revenue projections. COVID-19 has certainly had an impact on the highway fund, although fortunately it has not been as significant as that on other revenues in the general fund. Highway fund revenue deposited into the fund in 2020 was 6% lower than fiscal year 19 levels. And DMV projects that the next biennium, 21 through 23, will be approximately 8% lower than fiscal year 19 actual. We are going to continue working with them and continue working with our budget and with you as they come out with their new update and reflecting funding through March. So we'll continue to keep everyone apprised. And I should note that the highway fund user fee projections do include, so this chart does include restoration of the GST that was shifted for fiscal year 2021. That GST that was shifted and we're planning on being maintained in this next fiscal year estimates to provide approximately 1,870 job years over the biennium. So it is critical not only for delivering our program, but to keeping our economy moving and keeping Nevadans employed. All right, so our highway fund, you can see how we use our fund and our federal aid to cover over 99% of our operations. The pie chart at the right shows the amount of the highway funds, state highway funds, as they support the various budgets. Very similar, and this reflects the upcoming biennium, so NDOT at 923 and bond payments DMV and DPS. The federal numbers in our budget in the table actually reflect an increased amount of reimbursement due to a federal infra award of $50 million towards our Tropicana Harmon project. We received that last year. It was, as far as we know, the largest federal grant we've received at the DOT, so we're very excited to be able to put that to work and to really help deliver the Tropicana project more effectively and efficiently. Our federal aid, the FAST Act expired in September 30th of 2020, but they did allow for a 1-year extension on October 1st, and that has been funded. So we are anticipating that same level of federal aid as is shown on in the table. And at the bottom, you'll see our projected unrestricted highway fund balance versus the target. The target is used for budgeting, and it's equal to 1 month of our operational expenditures for all highway fund agencies and other appropriations, and 1.5 months of capital expenditures. So it really just provides us a 1-month buffer. It allows us to have the cash up front to pay our vendors and contractors and consultants while we wait for the federal program to reimburse us. They are a reimbursement program. It allows for cash to cover higher than average expenditures during the construction season. And it allows for the deposit schedule of highway user fees where the majority of the funding is deposited at month end. So it is critically important that we maintain that target. And you can see with the current budget, at the end of fiscal year 2022, we will have roughly 31 million above that target. But at the end of fiscal year 2023, it will be 34 million below the target. And again, this is based on level funding, 8% lower than fiscal year 19. We are hoping that as DMV comes out with their new projections later this spring, that will be adjusted. And this is how we spend our portion of the funding, NDOT expenditures. Roughly 78% of it is spent on construction and engineering. 16% is spent on maintenance and equipment. And then the remainder is spent on administration and support services. And some of the other categories include our multimodal programs, the traffic management centers, honor camp, airplane operations, bicycle pedestrian program. Yeah. All right, now the meat of our request and discussion today, the budget request summary. We have 8 enhancement units, decision units, and a one-shot appropriation that I will go over with you. The first one is our replacement equipment, E710. The state of Nevada Fleet Services replaces vehicles at 100,000 miles or 10 years. NDOT's replacement policy is actually 120 and or 10 years. Our heavy equipment replacement schedule is approximately 15 years and 200,000 miles. Unfortunately, as we've gone through economic downturns in the last recession and in this pandemic, we typically favor putting jobs into the community, and we defer equipment replacement. As a result, we've not been able to keep up with our replacement schedule due to the size of the fleet and the cost of replacement. Our current fleet consists of just over 2,700 units, including units received and in the process of being put into service, and replaced units waiting to go to state purchasing for disposal. Currently, 1,335 units meet replacement criteria. If these units were to be replaced today, it would cost approximately $176 million, and next year's number will be even higher. We're requesting to replace 8 passenger vehicles, 15 one-ton dump trucks, 11 half-ton pickups, 14 single-axle dump trucks, 12 tandem axle dump trucks, 14 wheel loaders, and 6 sweepers. Again, this equipment is critical to help us make sure that we're able to respond to events, whether they're normal events such as a snow event like most of the state is experiencing today, or an emergency event like the earthquake and the landslide I mentioned earlier. I should also note that we're planning on replacing approximately 10% of the department's radios as part of our cyclical replacement program. And this is separate from the radio upgrade program, as radios need to be replaced due to wear and tear. So that's in the replacement equipment budget. New equipment, so E720, we are requesting for equipment funding to replace or to provide new computer equipment, 1.25 million for computer equipment, 1.5 for non-rental equipment. We also need additional equipment in headquarters, for operations, computer, furniture, lab, shop tools, et cetera. And then we're asking for each of our 3 districts, front end loaders, 4 for District 1, 4 for District 2, and 8 for District 3. We actually anticipate this will provide a savings for the biennium, as we will no longer need to rent those loaders. We've been having to rent loaders because our existing repair parts for the existing loaders have been difficult to find given their age. So we're looking for that. And it's again, these loaders are used for mixing our salt and sand, loading salt or sand or debris into our trucks, as you can see on the image there, and clearing the roads as needed from debris, significant debris when we have it. It should be noted that 66 of our 132 loaders qualify for replacement, with 12 of them being 30 years or older, 10 or 25 years or older, 44 or 20 years or older. And we have reached out to our partners in the construction industry, and they are in agreement with our need for these 16 loaders we're requesting. Maintenance of buildings and grounds. So maintenance of our facilities is critically important to ensure safe and appropriate workspaces, meeting ADA requirements, environmental requirements, and fire requirements at each of our facilities, as well as for protection of our equipment and to ensure that we can stay up to date with our environmental stormwater criteria. This slide reflects improvements at headquarters as well as all 3 districts. The headquarters project is primarily siding repairs and a new roof for the old Hot Springs building in Carson City. The District 1 projects include a rehabilitation to the Washington Street site in Las Vegas, a new independent assurance lab to ensure that that the construction projects that we put out, that they meet the standards that are necessary, new maintenance worker housing in Mina, construction of sprung structures at Mina, Montgomery Pass, and Panaca. The sprung structures help us stay in conformance with our stormwater and environmental requirements, as they limit the spread during a rainfall event or wind event of salt and sand into the environment. Update to our maintenance station and Searchlight, and design of a new facility at Washington Street. District 2 projects include tenant improvements at the Galletti DMV building, which will allow us to ultimately consolidate our team and reduce rent across the community. Rehabilitation of our Virginia City maintenance station, design for a Lovelock maintenance station, critically important update and replacement of the GASX system on Mount Rose. This is our avalanche control system that is required to ensure that the Mount Rose summit can stay open can stay open year round. Another sprung structure and brine stations, again, to ensure that all of our maintenance stations across District 2 are able to efficiently respond to stormwater or snow events. And then District 3 is wash rack in Ely, designed for an Elko administrative building, addressing some retaining walls at the Winnemucca maintenance station, incidental costs for a future maintenance station in Collingwood, and Quinn River Bay extensions to make sure that the equipment up at Quinn River can be kept out of the elements and properly worked on in the interim. New positions. So we are we've identified 11 critical positions in the biennium. I should note that last biennium, the legislature approved the addition of 2 new construction crews, and we're thankful for that and are looking forward to seeing the full efficiency of those crews as we continue to build them out. The new positions requested in this budget are really required to effectively and safely operate the system and to meet statutory and regulatory requirements. The department, again, as I mentioned, has identified 11 critical positions. The first 2 are in records management program officers. In 2019, new laws and regulations were passed relating to the public records and privacy. And these Senate bills have greatly impacted the department, as well as just the nature of information requests. The department has had a large increase in public records requests and would benefit from these 2 new officers in order to make sure that we're in compliance with the requirements and avoid the potential for facing fines due to the timeliness of the responses. Human resources personnel, we're requesting 2 new positions. And these actually are as a result of new laws and regulations passed in 2016, adding requirements and new deadlines in the progressive disciplinary process. The new law creates stricter rules and tighter deadlines for impartial administrative investigations when an employee may be subject to suspension, demotion, or termination. And we need to hire and we need to have sufficient trained investigators to ensure that we're doing those investigations in a timely manner. The next position is an over-dimensional permit section. This would be an additional person to help with the help manage the increase in requested permits and the regulatory deadlines for permit issues. It's critically important that we have this department fully staffed, as overweight and oversized loads travel our network almost daily, and we need to make sure that we are able to provide them the safest route, put into place the proper controls to ensure that they're traveling in a safe manner, and that we're able to keep the public informed of what those disruptions may be, should there be disruptions. We are requesting 2 new positions in information technology positions. The first is an IT Manager 3 to take on day-to-day managerial duties of our service desk, desktop, and systems units to keep up with the workload. As I mentioned earlier, we are becoming more data-driven by the day, and it's important that our service department can be available to answer questions and keep the system functioning. So we really we're able to see the impact of the IT department in the last year during COVID. And the department has started to release new security tools, which will help identify, detect, and mitigate risks to our information systems. To that end, we're also asking for an IT professional to ensure that we have the resources to detect, identify, protect, and respond to potential breaches or other challenges to the security of our data. We are also requesting a traffic operations info technology manager, primarily to support our ITS network and systems that ensure the communication systems for our roadway conditions stay up to date. So this is a separate department and group from the IT positions. As you've seen across the state, if you've traveled at all, and I remember, I know many of us rely on the cameras. This is to make sure that our cameras stay up to date, that all of our overhead signs stay up to date, and that we're continuing to deliver the information that's needed to the public, and that information is connected and delivering the information we need to feed that information out. So this position will be key in maintaining service levels agreed upon by us with our partners in the local communities. And then we're asking for 3 traffic center technicians, 1 each per each district. As you may be aware, we monitor those cameras year-round, 24/7. And in order to make sure that we're appropriately staffing at that 24-hour level, we need at least 1 more position in each district. Right now, we're covering that with overtime, and so those new positions will not only provide overtime savings, but they'll also ensure that we have folks that are ready and monitoring the system that are not overly taxed by working too many hours, and so they'll be less fatigued. All right, this new student worker positions, I'm particularly excited about this program. This would be a new classification that we're requesting for student trade workers to help really develop and create the future workforce for Nevada. We struggle, as I know many agencies do, but we struggle with filling our semi-skilled and skilled trade positions across the entire state. And these new student worker positions would help train the workforce of tomorrow and provide a pipeline to feed into our organization and that of other departments if they choose to fill positions as well. I should note that these are meant for high school students. They would be temporary high school student worker positions. They need to be currently enrolled in an educational program leading to a diploma or a GED. That's different than the other positions that are currently available on a statewide basis where they actually need to already have their diploma or GED. So this would enable high school students or those pursuing a GED to get their foot in the door, get an understanding of what we're looking for, and even begin to get their training so that they could be hired on permanently in the future. Fuel system upgrade. So most of our department fuel sites were constructed in the early 1990s. The fueling system upgrade project began in fiscal year 2016. And as of today, we've completed 21 of the 46 fuel sites in this upgrade program. Updating these sites will allow the department to maintain compliance with current EPA standards. And it also ensures system dependability, safety, and performance. And that's critically important considering how many of our state and local departments rely on our fuel system across the state. The department has seen, we're asking for this additional funding because we've seen increases in construction costs since the original estimate of $16.3 million. So this additional 4.75 will allow us to complete all of the fueling sites planned for upgrade. The Nevada Shared Radio System is vital to ongoing operations and emergency response and provides nearly statewide coverage, including remote areas where cell signals are still unavailable. The project started in fiscal year 19, and many project-related process improvements have been put into place. It is moving one district at a time in order to maintain operations as efficiently as possible, starting with District 1, Southern Nevada. The project is very complex due to the required technology and the site locations being at remote mountaintops with difficult terrain and weather-dependent access. I should note that at this time, the system is moving along more slowly than originally planned as the vendor is behind their original projections. However, we do anticipate that the project completion in fiscal year 2024 is still achievable. And we do plan on working with the vendor to keep them moving forward towards that date, as well as utilizing all of the protections in our contract to ensure future milestones are met. I would like to request, or we are also requesting 2 reclassifications to create efficiencies within our environmental services and stormwater teams. Prior to fiscal year 19, our stormwater and environmental teams were separate teams. We recognize, though, that they both work towards a common goal and are now working together to achieve that same common goal. So to promote the efficient administration of those teams, we are promoting combining them under one chief, one administrator, 2 professional engineer at grade 47 to oversee the entire environmental service programs. The other administrator, 2, who was over stormwater, would be downgraded to an environmental programs chief, grade 44. And we would upgrade another position from a staff 2 to an environmental chief position at grade 44. So we would have one position 47 that currently exists overseeing 2 44s. Each of the 44s would specialize in either water-related environmental activities, including stormwater and wetlands, or non-water related, such as NEPA, cultural resources, air, noise, naturally occurring asbestos, and wildlife. That would be how they would be separated between the 2. And our technology investment request. So as I mentioned, we are, all state agencies are becoming more data-driven, and that is even more so at the DOT. So we need to continue to maintain our outdated legacy enterprise systems and keep them functioning and supporting our mobile and field workforce. So there's $9 million of this is really just to modernize our outdated legacy systems to keep them functioning and supporting the team. And the remainder of the request, approximately $12 million, is for a GIS system of engagement. This system will help us really pull together all of the data that we get from all of the different legacy systems. So for instance, the department currently has systems that collect data, including maintenance activities, crash data, pavement condition, construction, congestion issues, ADA issues, air quality, traffic counts, pedestrian fatalities, and other safety issues. And we would be pulling all of this information into one GIS platform that would enable us to take a holistic look of all of the issues regarding any segment of the road in one area to be more efficient in our planning and our programming. It will also help us better identify where we may have issues that we might not otherwise see if all of that data was dispersed across multiple units. And that ends my presentation, and I'm happy to answer any questions.
Thank you very much. That was a lot of information. And okay, so I do have a couple of folks who wanted to be recognized. I believe, Dr. Titus, you had a question?
Great, thank you, Madam Chair, and I have a couple if I might. First, I'd like to start with this slide, and you didn't have your slides numbered, so it's hard for me to reference exactly which one, but it's in reference to the highway fund revenue. And on there you had your gasoline tax, and it looks like you're looking at a 10% decrease in revenue from gasoline tax from 2020 to 2021. Do you have any reference from what it looked like in 2019? From my understanding, that's been declining now for a while. And perhaps when we get down to the subcommittee hearings, I'd like an overall view on the status of where that revenue source has been over, say, several years, not just from 2020 to 21. And we know that 2020 has been a very strange year, and a lot of predictions are off the table. And so it would help us if we had, from further on, whether that the revenue from that would be, how's that been affected?
Yes, Christina Swallow for the record. Dr. Titus, do I have the right slide up now?
Right. Well, you have it, the gas tax revenue, the actual, and then no, it was in the one next where I'm looking at when we actually had a percent decrease in what you projected the income was. And I just wondered how that fell within the 2018. Was there also, isn't this a trend that we're seeing, a decrease in fuel tax revenue?
I will get back to you with all of the specifics, but I will say we don't see a decrease in revenue as a whole, but we're seeing a decrease in revenue per mile operated and maintained, and a decrease in revenue per vehicle mile traveled. So while the revenue is slowly ticking up outside of a pandemic, it's not keeping up with the rate of driving and with the rate of growth in our assets. I hope that answers your question, but we'll get you more information on the historical revenue trends.
Right, and thank you. And I didn't hear you mention how we augment our funds and what the match is typically from our funds versus what the federal match is frequently. I understand we do pretty well with what we put in on some of these projects versus what the feds put in on some of these projects. Could you discuss that a little bit, please?
Yes, Christina Swallow for the record. Dr. Titus, thank you for the question. We are very fortunate. Our federal match rate is 5%. Now, it may be that we do end up matching at a higher rate, given the funding that we have in order to balance the budgets overall. We do try to keep that 5% and use every federal dollar we can and maximize the leverage of those state fuel dollars. So we match at the rate of 5% on most activities. Occasionally there are other programs that require a slightly higher match, but we're fortunate we have one of the lowest matches across the nation.
Thank you. And then on our your radio system, is that including our 511 system and those cameras that are out there? Who pays for those cameras? I just use an example. This morning when I drove in from Smith Valley, that 50 miles out there, I actually went online on 511, checked out those cameras, and they're such a big help to actually be able to look at that highway and know what the storms look like and those kind of things. And who's in charge of that? And is that under this budget, the radio budget?
Thank you, Dr. Titus. Christina Swallow for the record. And I'm actually going to ask Felicia Denny, our Assistant Director of Administration, if she can help me on how those are funded.
Good morning. This is Felicia Denny, Assistant Director of Administration. I'm hoping that you can hear me all right. Those blue signs that we all see as we're driving down the road, advertising that we have some places where you can stop and eat or stay in a hotel, those informational signs do fund our 511 program.
NDOT has a contract with a group that takes care of that. And those 511 is handled by our group that also handles the ITS systems, our traffic operations group.
Great, thank you. They're very important to have. Thank you. And my last question is, and I haven't heard it mentioned anywhere, under what budget are I understand airports are under NDOT, is that correct? And if so, when we get into the subcommittee, I'd want to learn a lot more about your airport security budgets and what you're doing there, and who's really, who's has that hat for airport security and airport maintenance, and I have concerns about generalized aviation throughout the rural area as a pilot, and where do you land and those kind of things. And I just need some more update on that. It doesn't have to be today. It wasn't part of your presentation, but I haven't heard it anywhere.
We will, Christina Swallow for the record, Dr. Titus, we will provide you that information. We have a minor role in oversight of the rural airports. We don't administer their operations or their security, but we will provide you some additional information in terms of what our role is and how we budget for that.
Thank you, and thank you, Madam Chair, for the questions.
You're welcome. All righty, I believe Senator Brooks was next.
Madam Chair, I was just looking at the gas tax and other user-related fees that would probably be distributed per capita around the state, like registration and license fees and gasoline taxes, and then its contribution to actual roadway construction and maintenance. And so on the gas taxes or the highway fund revenues in its entirety, do you have a breakdown on where all that money comes from on geographically across the state? Is it pretty fair to say that it's based on population?
Thank you, Senator Brooks. Christina Swallow for the record. It's not entirely based on population, and we can get you the information that we have. As we heard from Director Butler, some of her systems are fairly outdated, and not all of the information is available on a geographic basis, but that information that is available, we will provide that to you so you guys can get a fair look at how the revenue comes in across the state. And it doesn't quite match geographic distribution based on what I've seen in the past.
Okay, well, it's got to be somewhat close though, based on fuel taxes, registration, license fees, motor carrier fees. It's got to be in FRI. It's got to be pretty close to where the people live, right?
One of, Christina Swallow for the record, one of the skews on that is actually our truck traffic does actually skew. A lot of our truck traffic fuels in the more rural portions of the state. So that actually skews the number outside of the population distribution. But again, it's not terribly skewed, but we'll make sure that we get you that information. I don't have it handy with me right now.
Thank you. I appreciate that because it just kind of jumped out at me. I mean, we had talked about this in SCR3 in the interim and then, or SCR4. And sorry, I can't remember which one. But now, as we're going through this slideshow, 86% of the lane miles for the entire state of Nevada, rural Nevada, and probably about 15% of the dollars in the highway fund come from rural Nevada. And so that's about a 25-to-1 disparity between urban miles and rural lane miles. I just never realized it was that great. So thank you. I'd love to get that demographic information if it becomes available.
We will get it for you. We have it.
Other questions from other committee members at this time for the Department of Transportation? I guess I have a couple of real quick ones. So what I'm interested in is the priority list that's going to be tackled over the next couple of years. And I'd like to be able to compare it to the priority list that we've had So if we could pull the last couple priority lists and then where we are now, I'd like to see how projects are moved around and understand the decision process about how one moves up to the top faster. I know sometimes a project can be on the list for a very, very long time because it ranks lower, but eventually some of these projects do need to get dealt with. So, and I know especially interchanges, major interchanges tend to get bumped to the top, but there are other issues going on, knowing that, you know, it's not just in the central core of Washoe or Clark. There's other transportation problems around all of Clark County. So I'm just kind of curious as to how some of these projects are prioritized and where they are on the schedule. That's been a concern over the last couple of interims. So I'd like to understand it better. So if you could be prepared to talk about that with the subcommittee to make sure that we understand. You had said something about the Tropicana interchange. Could you expand upon that, please?
Yes, Chair Carlton. Before I go into Tropicana, I did want to let the committee know that we have, Christina Swallow for the record, that we are evolving our planning processes to be very data-driven as an outcome of the development of the One Nevada plan that was released just prior to the last legislative session. We recognize that statewide, the stakeholders had developed 6 prioritization goals, and that those should be driving our prioritization across the state. So we are evolving into that process using data to really address where the most critical safety issues are, where the most critical travel time reliability issues are, where the most critical preservation issues are, and we're using that to help shape and inform our prioritization moving forward. We're in the early stages of that, but I wanted everybody to know that we are evolving into a very data-driven organization in terms of not just how we operate the system, but how we plan and program the system. And so I look forward to having conversations with you about those priorities as we share those with you later on. In regards to the Tropicana interchange, that project, we are in the process right now of procuring our design builder. We anticipate having the design builder on contract or an agreement by later this year. Summer is our current anticipation for that, but sometimes there may be a need to extend the procurement if there are adequate, substantial questions that we maybe need to address. So we're working on that procurement process. Once we have the design builder on, they will need to complete the design, but they will be able to also start construction as the early design elements begin to be completed. Similar to what they're seeing in Washoe County with the Rena Spaghetti Bowl. The design is not yet fully complete, but construction has already begun. And that is similar to what happened with Project Neon in Las Vegas a few years back. So it will be, the project will include HOV ramps to and from the south. So on an HOV southbound on-ramp and an HOV northbound off-ramp to Harmon to provide additional access to the resort corridor between Harmon and Tropicana. It will also include a new Tropicana bridge, which will be lengthened to provide additional space underneath for future improvements to I-15. It will be raised to reduce the probability of impacts to the bridge, which close the interstate, and which we've seen. If you drive under it, you can see the impacts of those trucks that have hit the bridge in the past. It will also include upgraded movements along Tropicana, eliminating the full signalization on both sides of the freeway to allow free on and off, to allow the Tropicana through movements to operate more efficiently. We're excited about the project. We've been working with the local stakeholders on the maintenance of traffic requirements in terms of what types of closures will be allowed for our design builder, whether or not they'll be able to take the bridge down as a whole or if they'll have to do it in pieces. And we're really excited to deliver this project because it was not just with the through movements on Tropicana, which is critically important for anyone crossing the valley, but also it will enable us to do future improvements along I-15.
Okay, all right. Thank you very much. I appreciate that. I believe Assemblyman Watts has a question.
Yes, thank you, Madam Chair. I was just wondering, it was my understanding that the last relief package contained some assistance for transportation, and I was just wondering if you could provide a little bit more information on how that has influenced your budgeting and your proposal.
Yes, thank you, Assemblyman Watts. Christina Swallow for the record. The last proposal, last bill that was approved just before the end of the year did include a provision for DOTs. In total, it was $10 billion for the DOTs across the nation. And that we just recently received the information on how much that would be for our program. I'm trying to find my specific notes so I don't mistell you anything. But our program at the state DOT would be $90 million. That revenue must be obligated by the end of federal fiscal year 2024. They gave us additional time to do this because it is meant to be a backstop and buffer to the federal or to the state revenue loss that we've experienced due to the reduction in state sales gas, state fuel taxes. That 8% reduction that the DMV is projecting that we will endure for the next 2 years, it's meant to help us recover from that. As a result, the funds are also more flexible than typical federal funding in that we can use them on any aspect of our program. Again, recognizing that the federal funding is severely limited and we wouldn't be able to flex federal funding otherwise to help backstop that loss in state revenue. So we can use it to help purchase new fleet equipment if we need to. We can use it to help with cover the cost of the operations on our fleet for cleanups, for any of that stuff, as well as for additional projects. I should note that approximately 20% of that 90 million is directly sub-allocated to our MPOs. So the Washoe MPO, Southern Nevada, and the Tahoe MPO will each get a portion of that funding. We'll administer it as we do with other sub-allocated funds via a local public agency agreement. So they will be able to prioritize that 20%. As we get more information in terms of how the funding is going to be distributed, recognizing it will be reimbursable just like the federal program is typically, we are working on determining how we are planning on spending that revenue. We just got the final numbers here last week.
Wonderful. Thank you. Thank you, Madam Chair.
It's not reflected, I'm sorry, it's not reflected in the budget request because we did not have the information at the time of the budget request.
Understood. Thank you for the clarification. Thank you, Madam Chair.
And thank you, Mr. Watson. And please work with our staff in being able to true up what the federal dollars will be able to pick up as far as some of the things in the budget and where we actually are and what the plan is. I know it's a moving target. So we asked you to put documents together before you ever knew there was a conversation about that plan. So let's go ahead. You can work with them as far as truing it up to take it to the subcommittee. So that'll be great. I guess I'd like to ask about the student worker initiative. We had talked about this, I believe, a number of years ago. And I think one of the concerns was that a lot of times in state employment, or even in internships, depending upon what the position was, the student needed to be 18 years or older in order to be involved in a state project. So if you would expand a little bit on what you're actually thinking about the state worker program, will this be a paid position to the student? Are there classes associated with it? What does this program look like in your mind?
Christina Swallow for the record. Thank you, Chair Carlton, for the question. This would be open to students that are under 18. It is intentionally written and planned to be for high school juniors and seniors, although arguably it may open the door for others that are older than that, but never finished their high school diploma and are now in a program to get their GED. The intent of the program is that it would be paid for the student workers, and they would get their foot in the door and start learning our program and what needs to be delivered. They would be working just alongside our team members, just as our con aides do and some of our other entry-level positions are. It is truly meant to be entry-level. I don't yet know if we'll have specific classes for it, but we do have classes to train all of our team members on those skills that they need to have to be efficient and to deliver the program. So there will be training provided as well, and it may be on-the-job training as well as formal training for those student workers. But really, we are hoping that it will create a stronger pipeline into not just our department, but into state service, and are hoping that the classification will be something that other state departments will be excited about using as their budget and needs allow in the future.
Okay, and I know they'll dig further deep into this, but how many positions are you thinking about to start with?
We are currently asking for, I need to go find that slide. We are currently asking for 5 positions for each district. So 15 total, recognizing that there are needs across the state for both opportunities for the students, opening the door and giving them a foot into the door, as well as needs for our department. So it is 15, 5 in each district.
And about what classification are you looking at? What would the pay rate be?
I'm going to have to ask Felicia Denny, our Assistant Director of Operations, if she has that information.
Okay.
Hello again, Felicia Denny, Assistant Director of Administration. I'm going to pull up the classification. I don't know that I have the salary in front of me at this moment, but if you'll bear with me for just a moment, I will grab that for you.
And that's fine. And will these be full-time or part-time considering they're students?
They would be only part-time, and they would be expected to be attending school. Tracy, do you want to?
Okay.
They are a grade.
They would, it hasn't been established, but they would be looking at about a grade 10.
Okay, it has not been fully established, but we're looking at approximately a grade 10.
So it was, and it is a requirement that they stay in a
I have Tracy Larkin walked into my office, our deputy director, who's about to retire, and she has really been working hard on this. And it's a requirement of this program that these students are attending a high school or a GED program, and so they would be part-time. Our budget reflects what it would be if it was full-time, although we're not expecting that. It's just the way that the system would work rather than trying to estimate hours. We thought we would give a upper level, but they are expected to remain in school, and they would be eligible to work until 6 months after graduation. I hope that answers your question.
Yes, it does. It answers some of the basic questions, and I'm sure we'll get a little bit more into it. So I just want to make sure that I understood. We have a lot of student worker programs, we have internships, we have apprenticeships. Sometimes they tend to cross. That gets a little gray between the different categories. So I just wanted to make sure that I understood exactly what you were trying to do. And I think it's great. The more we get young folks involved in state service and they see what opportunities are out there, it might inspire them to stay in school and upgrade their skills and do other things. So I think it's an excellent conversation to have. I just want to make sure the students are compensated appropriately, but they do stay in school on top of it. So thank you very much. I appreciate your answers. Are there any other questions from any other committee members on the Department of Transportation right now? And Dr. Titus, you'll notice I did not ask anything about rest stops this time, but I will be in the future. Okay. All right. Well, not seeing anyone else with any other questions. Thank you very much. We appreciate you being here. Look forward to working with you when we all get to Carson City. So with that, I believe we can move on to our next item, which is the Department of Corrections. If we could go ahead and queue up the appropriate administrators and folks presenting, please.
This is broadcast. Do you guys need some help with sharing?
Thank you. I'm actually grabbing it right now. My PowerPoint just closed, so bear with me for 1 minute. Apologize.
No, use screen share. If you go ahead and select the actual application, it won't show your desktop. So just select PowerPoint instead of screen 1 or screen 2.
Awesome. Thank you.
Thank you.
Can everybody see the screen okay?
Yes, I can. Thank you.
Thank you. Okay, I think we're ready to begin. Director, do you want to lead us off?
Good afternoon, everyone. This is Charles Daniels. I'm the director of the Nevada Department of Corrections. And it's a pleasure to be able to appear before the Legislative Commission's Budget Subcommittee. Next screen, please. We have quite a bit to talk about, but we'll try to be as expeditious as possible. I would, though, before we go anywhere, like to introduce my executive team. We have quite a few new members, and I think most of you may know me, but I would like to go through the list just so you can get an idea of who will be speaking today, at least in part. At the bottom left, you'll see James Jones. He's our Inspector General. Beside him will be William Cahuenga. He's our Deputy Director of Prison Industries, and he's also serving as our Public Information Officer. We have Harold Wickham, who's our Deputy Director of Programs. Beside him, Brian Wickham, who's our Deputy Director of Operations. Just so you know, those two switched roughly 2 months ago, so they're both in new seats, but they're very capable. We have Christina Shea, who's our new Deputy Director of Support Services. She has been a breath of fresh air. She's very talented and she's just a breath of fresh air to have on board. Beside her, we have Dr. Michael Maneff. He's our medical director, and he spends quite a bit of his time not only managing the agency, but dealing with COVID-19. And then beside him, you have Christina Leathers. She's currently our Chief of Human Resources. Next screen, please. So we're going to go over roughly 8 areas, and as we get into each of them individually, I'll have some discussion. However, we're going to go over our mission and vision, which I think is important. Then we'll transition into our goals as an organization, followed up by our major issues of this fiscal years, I should say. Then we'll transition into our population trends, followed by capacity and housing, and then the governor's recommended budget. There'll be quite a bit of information also related to medical, and then we'll follow that up with prison industries, and then slide on into a questions and answer session. Of course, if there are any questions along the way, please don't hesitate to ask. So if I can get to the next screen, I'm going to get right into the presentation. Very first thing, though, I'd like to do is to start off with our mission statement. The mission statement was important to me and the organization, and it was important to get the information out on what the changes were. They're not nuanced, they really mean quite a bit. So let me just start off. It's our mission of the Nevada Department of Corrections to protect society by maintaining offenders in safe and humane conditions while preparing them for their successful reentry back into society. If you were to just go back and look at the phrase maintaining offenders in the safe and humane conditions, I take that very seriously because that comes right out of the 8th Amendment of the U.S. Constitution, which amongst other things also guarantees those safe and humane conditions. It's important that we go beyond out of our way to ensure that those inmates or offenders, those people have been removed from society as their punishment. They didn't come to prison to be punishment, they were removed from society. And it's our job at a minimum to get them here, to assess them, to ensure that they have what they need. And we're also able to ensure that we can keep the more violent and or predatory inmates away from those individuals so that everyone has a fighting chance to be able to come and assimilate, and then we can start working on preparing them for their eventual reentry back into society. That reentry back into society literally starts day one on our assessment. And we take that assessment seriously because it encompasses mental health, addiction medicine, your education, vocational training, work skills, anger management, and your ability to get aware, your ability to be able to deal with the other humans on this planet. And hopefully if we do that right and put you on an appropriate track of addressing the issues in which you have a shortcoming, you can obviously walk out in a much better position to be able to survive. Our staff will also utilize innovative programming that will focus on education, mental health, substance abuse treatment, and vocational training as the cornerstones to an offender's rehabilitation. Our goal would be to ensure, one of our goals would be to ensure that there's a great probability, not a possibility that you won't reoffend, but a great possibility of success. And so we designed our processes and our protocols and procedures to engage the inmate and ensure that we can put him on a track that will have him wanting to get back into society and show everyone that not only can he make it, but also get off of the public role and be able to take care of his kids if he has any, and a family, and start over and start anew with a good, solid, positive attitude. By the time we get an inmate, he's already gone through 3 portions of our judicial system: the enforcement piece, the prosecutorial piece, the judicial piece, and then we catch him on imprisonment. But this is the part where we actually engage with this person on a day-to-day basis and try to eliminate negative behaviors that will do nothing more than encourage him to come back, and really able to focus in on what his future will look like and how he can take advantage of all the opportunities available to him. Then we're going to pass this individual off to supervision, and hopefully we'll never see him again. And then at that point, once the supervision is done, this individual has paid his debt to society. He's now complete, and he's ready to go, and he's going to make a difference and hopefully be able to go back and emulate appropriate behavior so that the people that he interfaces with or she interfaces with can see that there's a better way to go. Next slide, please. So along with this, we've taken a lot of time and effort, this executive team, and we've gone throughout the state, and we've taught every level of staff member, whether it was the executive team or managerial staff, our assistant managers, our supervisors, and all the way down to the lowest level. We've gone out and we've explained all of this to our staff. And we didn't just send memorandums out. We actually engaged in conversation through town halls about what this means and how they are relevant in this process. So important, our vision is that everyone operate in a team-based environment. None of us can do everything by ourselves, but the good thing about that team environment is, even though we may always be outnumbered, never have enough money and never have enough time or other resources, if we work together, we can accomplish many things together. We also want to hire, train, equip, support, mentor, and promote high-quality corrections professionals. We further want to provide humane, safe, healthy, and protective custodial care, rehabilitative opportunities, and reentry assistance for offenders. We want to hold them to the highest professional and ethical standards, of which we spend a lot of conversation about what does it mean to be a peace officer? What does it mean to operate under color of authority? What does that mean when you've been given the authority to have dominion over others? Do you wield that power accordingly, or are you abusive? And we've indicated to everyone, under no circumstances will we allow you to operate outside the scope of your authority or outside the scope of the law. We're also committed to the protection of the public, the safety of our staff, and also the security of our offenders. And that's a very legitimate concern, that no matter what time of day, no matter what time of night, we're going to have enough staff available that can obviously intervene in anything and everything that is important to ensure that you feel safe enough to move further with continuing your family ties and or improving yourself. We also spoke quite a bit about embracing diversity and recognizing the value of dignity of staff, inmates, and the general public. As you know, this past summer, we had quite a bit of conversation about racial animus, discrimination, things of that nature. We decided to just go right after it. We went out there and we spoke to our staff about this, what some people thought would be a difficult topic. I didn't see it as a difficult topic, because when you're talking about respect and embracing others and understanding that everyone's deserving of dignity, regardless of whether they wear a uniform or if they're inmates, it just doesn't matter. And we're going to strive to ensure that we treat everyone the same. And our staff fully embrace and understand that regardless of your differences, whether it be racially, religious-wise, ethnic origin, it just doesn't matter. Dignity and respect is what's important to everyone. We also want to establish meaningful partnerships with the public and private entities. We know that right now it's very difficult, but not impossible, to be able to move forward on a lot of the either programs or initiatives that we have, but most of it now is going to require a partnership with volunteers and with other entities, private and public, whether in the furtherance of either educational activities or goals, or just trying to make a difference in someone's life. We need to ensure that we embrace the outside and have them come in and participate in us being successful at helping society be much better. We also want to deploy evidence-based and outcome-oriented strategies. My predecessor, Director Zarenda, did a great job in getting that going, and we're certainly going to continue that process. And then, of course, we want to reduce victimization and recidivism by providing offenders with incentives for self-improvement and the tools to effectuate that change. If I could get the next slide, please. All right, so let's go ahead and transition to some of our goals. They're very clearly stated, and I'm not going to spend a lot of time on these, but I will tell you, these are very important. And you need to understand that these aren't slogans. These are actually things that we've implemented and put into what we believe is now the framework for our strategic plan, such as maintain a safe environment for employees and offenders. We also want to establish an agency strategic planning. I was somewhat taken aback that we didn't have a strategic planning process. So there's no way to particularly measure where we are and where we're going and when we're going to get there and whether or not we're on an appropriate cadence. No big deal. We decided that that was important. We have to be able to plan for the future and know where we're going. So we sat down on an exhaustive process to work together a strategic plan. We already do happen to have the framework for it, and the implementation is what we're getting ready to work on now. We're also looking at maintaining industry standards and best practices. As most of you know, corrections is actually, it's more than just a job, or corrections is a profession. And in our profession, like any other profession, we have standards. The American Correctional Association develops the standards for modern corrections. And then in terms of the other piece of that is, where do you learn about and stay abreast of and stay in accordance with the industry best practices? And that would be the National Institute of Corrections. So both of those entities are a major player in the arena of corrections in the profession. Right now, we are not certified under either processes. My goal at some time in the future is to, of course, seek and maintain that accreditation. However, even without it, we certainly know what those industry standards are, and we certainly know what the best practices are. And even if we are not able to initially obtain certification, we can certainly strive to do the things that we are able to do. Next, we're going to develop our emergency preparedness program. There are several areas that need to either be created and or shored up. I'll give an example of a few. Right now, we don't have an active shooter protocol system. So of course, that's a big deal. And when they happen, they're very dangerous and they can take over a facility, whether from the outside and or from the inside. We certainly now have the expertise to be able to develop that capability. And it's our goal to be able to effectuate it. The good thing to it is that it won't cost any money. We're also going to further develop the incident command system. It's called ICS in our industry, but it's the ability that for us to be able to utilize the same communication response model that all the fire departments and police departments use, and also the military, quite frankly. We need to become very proficient in the execution of our ability to mix it up with the other agencies. And it also gives us a much more fluid operations center when we have issues. We actually started the process when COVID hit hard, and we developed emergency operations centers at all of our facilities. If we hadn't had those, there's no way we could have managed as well as we have. So once again, between that and crisis management, our protocols right now doesn't really exist. Even our CERT team, it's a CERT team, quite frankly, a name only, but it's not in capability. It is our goal to ensure that we are more effective and more efficient and operate as a full-fledged emergency operations team. We'd also like to engage in evidence-based programming to assist in modifying offender behavior. There's nothing more important than what we can do is that to actually engage these inmates in evidence-based programming and to be able to help them see that they can change their lives and their lives can be different and that they do have the ability to be able to enter back into mainstream society with a skill or a group of skills, and also be able to take on something meaningful as getting up the same day and having the dignity of a job in which you get paid a check. We can't wait to do that, and we know that it has a greater impact on society because the people that are around them get to emulate their behavior and see that, yes, we can be successful regardless of our socioeconomic status. We also want to move forward and reestablish or enhance offender family interactions. We know that there's a much greater chance of these offenders being successful if they stay connected to or are able to re-engage their families and be able to be positive. And right now, many of our offenders are takers. They take money coming in. Little Susan, little Johnny needs X, Y, and Z, but the mother or the grandmother sends money in to these offenders. We want to be able to say, hey, you got to stop being a taker, and we're going to be able to show you how to get back into the family and how to assist them and how to help them grow. So when you get out, you're ready to pick back up and come together as a family unit. And society in general will benefit greatly in this arena. We also want to foster outreach and partnerships, and I've touched on that before. Obviously, deliver quality health care. In any correctional environment, this is important. The money that is drained from the system and from the taxpayers is extraordinary if you don't seek to develop quality health care. And that includes having a much better diet, and that also includes ensuring that these inmates have the ability to get out and exercise. And then finally, we would like to implement professional development programs. Now, obviously, that's for our staff, but we don't want our staff to see what they do as a job. We want to see it as part of a career and an avocation, something you enjoy. For instance, I can speak for everyone here at my table and the tables up north is that, listen, we love this. We love being immersed in trying to change lives and make lives better. And we want our staff to be able to see that this is not a job, it's a career, and it's a very, very worthy profession. Next slide, please. So a few of our major issues for 2021 through 2023. You've heard most of it, but let me just run through it very quickly. Number one, our COVID-19 pandemic. It's been huge. We've been battling it. We actually started before it was even common to know. We started in February, last week of February, this past year. And ever since then, we've been putting into place our protocols, procedures, all of the things that you would imagine one would have to put into place to deal with the pandemic. Many of our staff have gone through the SARS, the MARS, the MRSA, any acronym that you can probably think of, we've already dealt with. But this one was much more challenging because of its lethality, and there was no way to really tell who had it. We were in the top 3 in the nation for many months up until I believe it was July. And when I say the top 2, we had the lowest amount of inmates getting it because we had implemented what we would call a firewall strategy, and we did anything and everything we could to keep it out. However, the tide changed after what was considered to be the second wave, and that's when many of our staff started going back 4th of July, visiting one another, and unfortunately, it was able to spread within our facilities. It is under control now. I think we've done a tremendous job at addressing all of our issues, but it's been an ugly fight, and I'm really, really happy with our medical team and our correctional teams and the efforts that they put in mitigating it. Then I'll also transition to our healthcare as well as our Hep C. We still had that running alongside of COVID, and once again, that's been challenging as well. We would also like to talk about what we're trying to do at Ely State Prison as well as Ely Conservation Camp. We ran through a very trying time this summer in which we quite frankly ran out of staff to be able to manage both of them at the same time. Unfortunately, I had to take the action of merging the staff from the camp and dispersing those inmates out to other camps just to be able to man out and have enough staff at ECC. Our goal is to obviously open it as soon as we can, but it's going to be primarily dependent upon whether we're able to get more staff, and many of them come back off of COVID-related absences, and or maybe switching the, I was going to say mission, but that's not it, the classification of Ely State Prison along with High Desert State Prison, but we can speak about that in a few minutes. We're also really going to give a concerted effort of trying to revitalize and revamp our recruitment and retention process. It's been very difficult in our remote rural areas, of which we have all over the state. And it's difficult when you're trying to maintain a workforce and keep inmates out there when, in many respects, we don't have enough staff to monitor the inmates on a regular basis. And certainly those staff that do work up there aren't really able to take time off. So then after that, we're going to really try to transition to task-based staffing. We currently have a post-centric staffing model, which is inefficient and quite frankly outdated. We need to be able to switch from that post model to something that will help us out, like a more task-based staffing model. It'll take the same amount of people. We won't need additional staff for it. But what it is, it allows a person to come in, instead of bidding on a post, they bid on a series of tasks. And depending on the type of task, some might take 45 minutes, some may take an hour, some may take 2 hours. But we're able to move our staff around and get them to work together to accomplish a lot of things that, quite frankly, may not have even been done before. So let me give an example. Because of our post-based staffing and being short, we don't spend a lot of time on narcotics and cell phone detection, gang management program, or enhancing our intelligence gathering. We certainly don't have an appropriate confidential informant program. We don't do enough phone monitoring. We certainly could do much better at stopping the manufacturing of weapons. But more importantly than those, right now we don't spend a lot of time on dealing with continuing criminal enterprises. A lot of the guys come to prison, they still are able to deal with narcotics and so on. What also, I really want to have an impact on human trafficking. That's important to me. And then, of course, being able to deal with extortion that goes on inside and outside our prisons, as well as preying on the elderly. I think we can do a much better program on that. So then, of course, I want to look at modern corrections and look at our technology and what we can do to have an impact on that. So at this point, this would be a great time for me to turn this on over and discuss our population trends. Deputy Director Harold Wickham will take us from here. Harold, are you there?
Good afternoon. Thank you. Yes, sir. For the record, my name is Harold Wickham. I am the Deputy Director of Programs Good afternoon, Madam Chair and distinguished committee members. I will briefly discuss the population trends. Forecasting the male and female prison populations has been severely complicated by the COVID-19 pandemic. This is on top of two major events that increased the uncertainty of our population. Number one being the recent dramatic decrease in Newport admissions, and then number two being the implementation of AB 236. Parole board grant rates are trending upward. The JFA projects the rates to continue on the same trend of 60.5% for males and 80.4% for females. And the length of stays for the paroles is trending downward. So the question is, how long will it take to correct for COVID-19 impact? That's a tough question. But our talented economist team and the JFA will continue to monitor all internal and external data and present the best population estimate possible. There will be one more iteration of this report for the 2021 budget cycle, and we will examine the new data and trends as they become available. And if we go to the next slide, you'll see this is, you can see on the slide that the red line is the legislatively approved male population forecast, and then the actual forecast being in gray or black, depending on the monitor. And then, of course, we have the JFA projection, and you can see the trend there. Next slide shows the female population trends. Again, you can see the significant decrease from the projected and the actual population trend, and then, of course, the JFA trend as well. The next slide. In this slide, you can see the 2019 male admission and release trends. 755 more releases than admission. And then again, in the 2020, you'll see that we had 1,084 more releases than admissions, again showing that downward trend. And then on the last slide, the female admission and release trends, we'll see the same thing, but in a lower volume, obviously. 2019, we had 54 more releases than admissions for our female population. And then in 2020, significantly more, were 242 more releases than admissions. Next, I'll just turn this presentation over to our Deputy Director of Support Services, Christina Shea, and she will brief the caseload adjustment.
Good afternoon, Chairwoman Carlson and members of the Legislative Commission's Budget Subcommittee. I'm Christina Shea, Deputy Director of Support Services for the Legislative Record. So the caseload adjustment, the Nevada Department of Corrections is experiencing a decline in its population, as previously shown on the population trend slides. Of note, just for the legislative record, I found an error in the prior PowerPoint slide, so just wanted to make sure that the committee members may notice it's a slight difference between the leg-approved fiscal year 2021 numbers that might be in front of you. So just to make sure that the legislative record is clear. So the fiscal year 2020 actual population as of June 2020 of 12,395 inmates is roughly a 7.5% decline compared to the 2021 legislatively approved population of 13,324 inmates. It's a pretty substantial decline. Based on the most recent JFA, the GO1 budget includes a projection of 12,345 inmates in fiscal year 2022 and 12,349 inmates in fiscal year 23. As of December 2021, NDOC has an average inmate population of 11,309 inmates for fiscal year 21. Although our fiscal year 21 average is lower than the JFA projections, the forecasted increased population is due to uncertainties, as mentioned by Dee Wiggum, related to the JFA projection. And in conclusion, the governor's recommended budget has a caseload reduction accordingly with the inmate populations over the 21-23 biennium. I'm going to pass the presentation back over to Director Daniels.
Thank you, Deputy Director Shea. I'm just going to briefly discuss our capacity and our housing. One of the things I'd like to point out, there may be some members that aren't exactly familiar about where we are and what we do. We have 7 large institutions, secure facilities, and then in addition to that, we have 11 rural camps. And when I say rural, we have some in the most northeastern parts of the state. And I'll give an example. Our Wells facility and our Carlin facilities are about 2.5 hours from Ely, if you know where Ely is. And also we have Humboldt, which is northeast of Lovelock, which is about 45 miles up that way. So we're spread out uniquely around the state. And in many of these areas could not be called population centers at all. In terms of our available beds, we have about, in terms of male inmates, we have roughly 1,200 beds. And I'd like to point out that we were able to successfully return our inmates that were housed with private corrections down in Arizona. We're able to return every single one of those inmates with the exception of one who happened to have committed a new crime down there. So they're being held over until the state of Arizona is with them. Also, as it relates to our female beds, we have roughly 331 female beds. So our numbers are pretty decent. Obviously, there's some reasons why. And I think most of you know it would have to do with COVID and the fact that there's been a slowdown in arrests, and a lot of that will have to be adjudicated later. But right now, it's given us an opportunity to be able to get our inmates where they need to be. I'd like to turn this back over to Deputy Director Shea at this time.
Thank you, Director. Christina Shea for the record. So the Nevada Department of Corrections is primarily funded by general fund appropriations. As the pie chart indicates, the general fund appropriation is roughly 84% of total funding for the department. The governor is recommending $665 million in general fund appropriations over the 21-23 biennium. And the next largest funding source outside of reserves is store sales, sales through our commissary, which is roughly $29 million over the 21-23 biennium. Additionally, the governor's recommended budget includes $5.53 million for room and board charges, which is a general fund offset for the Nevada Department of Corrections. Additionally, the governor's recommended budget includes funding for 2,946 FTE department-wide. So when we talk about the activity budget, the performance measures are used to measure the most essential functions which the agency is funded. As the pie chart indicates, the largest performance measure for the Nevada Department of Corrections is related to our medium, close, and maximum security activities. This performance measure includes maintaining the inmate's safety and security within our facilities and institutions. And then after that, the next largest performance measure is prison medical, which is coming in at 16% of our total activity budget. So moving on to our major budget initiatives. The first major budget initiative is the comprehensive staffing study. The governor recommended budget includes $289,000 in general fund appropriations to fund a comprehensive staffing study department-wide. The study will provide an objective overview review by a third-party professional contractor who can conduct an audit for the department's staffing. The goal of the staffing study includes review of modern corrections and task-centric staffing models, as the director indicated. Additionally, shift relief calculations with multiple year data points, updated post charts, analysis of operations to provide efficient and effective staffing recommendations, and finally, provide an alternative to the 2014 ASCA staffing study. So moving on to the next budget initiative, major budget initiative, it is the new assistant to the director. The governor's recommended budget includes general fund reductions of $100,000 roughly over the 21-23 biennium to fund a new unclassified position in the director's office. The position will provide the department with senior advisory and be a key contributor in fostering a culture within the department that aligns with and supports the mission and vision and priorities of the director. The incumbent will be responsible for strategic leadership, performance measuring, efficient, effective operations, succession planning, and coordinate work efforts, policy, AR, and procedure compliance. The position is funded through the elimination of 2 positions, a personnel officer 2 and an IT professional 3. So moving on to the next major budget initiative, this is Office 365. The governor recommended budget includes $2.4 million, primarily of general fund, for the implementation of Office 365 for email and office productivity to bring corrections in line with the Smart 21 project, which was approved during the 2019 session. Moving on to the next major initiative, the governor's recommended budget includes $236,000 roughly to fund necessary replacements, replacement equipment department-wide with varying funding sources to replace equipment which has exceeded its useful life. The next major budget initiative is the law library e-filing court mandate. The governor, this request funds 2 administrative assistants at Southern Desert and Florence McClure to comply with the court mandate for civil and habeas corpus e-filing as previously approved in prior legislative sessions. This is funded through inmate welfare funds in the amount of $201,000 roughly. Going on to the next major budget initiative, it's the continuation of rural pay at Ely Conservation Camp in Ely State Prison. As background, the 2019 legislature approved a 5% rural pay increase for all custody positions, lieutenants, sergeants, seniors, and COs at ESP and ECC, and this request will continue that funding. It's funded with $624,000 of general fund appropriation. So moving on to our one-shots. The governor is recommending $2.2 million in general fund appropriations to fund the update to the Nevada Offender Tracking Information System, also known as NOTICE. This is a tin and a tire request for the agency, and the Syscon Next Gen upgrade, which would allow the department to avoid costly, unsupported software expenditures, and it would bring our NOTICE system to the latest version of the software. The next one shot is the OSM. The governor is recommending $1.4 million to fund the Offender Sentence Management, OSM, reintegration back into NOTICE. OSM performs the sentence calculations that are required by NRS and was built in-house with Java technology that unfortunately we're not able to support in-house. The reintegration will allow Syscon to provide the support. And so, like I said, Syscon is our vendor for the NOTICE system. So it would be basically full reintegration of OSM and NOTICE. So moving on to the next one shot, surveillance cameras and storage area networks. This request funds the continuation of critical surveillance camera systems department-wide and replaces storage area networks department-wide. The storage area networks provide data backup services for critical software development, and all of these items are past their useful life. This would be funded with $247,000 roughly of general fund appropriations. Moving on to the one shot for culinary equipment. This would fund equipment at High Desert State Prison, roughly $102,000 in general fund appropriations that beyond its useful life at High Desert State Prison. Additionally, there's a one shot for $196,000 of general fund appropriations that's recommended by the governor for medical equipment that has exceeded its useful life department-wide. It's both dental and other various medical equipment department-wide. And additionally, the governor is recommending $6 million in general fund appropriations to fund the HCV consent decree from fiscal year 21 to treat inmates for hepatitis C. And finally, the governor recommends $500,000 in general funds to fund a potential shortfall in category 50 inmate-driven costs in fiscal year 21 due to the Superior Court ruling related to the NDOC nutritional adequacy for food in the prison system. We're going to be monitoring that situation closely, and we'll be connecting with the committee and LCD staff to bring current information as we get closer to the end of the fiscal year. So moving on to inmate-driven rates. As the committee is aware, the Nevada Department of Corrections uses an inmate-driven rate to capture costs associated with operating supplies, inmate supplies, clothing, inmate labor, food, and bakery items. And as you can see by the chart on the right, the department is experiencing a 32.74% increase overall on average between the 2019 legislatively approved rate, which was roughly $1,310 per inmate, to the governor's recommended rate of $1,739 per inmate. The primary reason for this is, like I said, due to the increase in the food costs that we've experienced department-wide. We've seen a roughly 35% increase in the costs in order to implement the new menu based on the Superior Court ruling. Moving on to the 2021-23 CIP, I want to thank the staff of the State Public Works Division for working effortlessly and tirelessly putting the CIP together. The Department of Corrections historically consumes or is recommended to consume a large percentage of the projects and funding associated with the CIP. And it's really to address the critical maintenance issues that we experience department-wide with our aging infrastructure. So the governor's recommending 17 projects, 123.3 million of state funding to provide the necessary critical upgrades to our facilities. And additionally, statewide projects, there's 3 projects, roofing and fire alarm projects at 3 institutions. So I'm going to pass the presentation over to Deputy Director Wickham. He's going to provide an update for the committee on our programming.
Good afternoon, committee chair. For the record, Deputy Director of Programs Harold Wickham. I've moved a little closer to the microphone, so I hope that takes that muffled sound out of my voice. But I want to just give you a quick briefing on our program grant funding and where it comes from. Our statewide recidivism reduction grant, known as the SRR or SSR grant, which is part of the Second Chance Act, that funding ends in September 30th, 2021. And we're currently working with UNR to determine our outcomes and our pathways moving forward with that. Next would be the State Criminal Alien Assistance Program, referred to as the SCAP grant, which provides for correctional officers' salary costs for incarcerated undocumented aliens. In 2018, we were awarded 1.2 million, and in 2019, 2.9 million. The 2020 application was recently posted, and we're starting the process for applying for that funding as well. Next would be the Sexual Assault Kit Initiative, or the SAKI grant, which provided approximately $860,000 for collection of DNA. And we're working with UNLV for gap analysis and data validation on that project. Then we have the Adult Reentry Employment Strategic Planning Grant. We're calling that the ARES grant. It's a 2-year grant for $654,000 for returning offenders to the communities with employment and career pathways, as well as employer development projects. And then we have the AB 236, the Justice Reinvestment Initiative. That was for $231,000 to meet compliance and to positively impact our reduction in recidivism rate. And I'd also like to note too the RSAT grant, which is the Residential Substance Abuse Treatment Grant. And that's going to be used to fund one of our new Substance Abuse Counselor 2 positions, which is necessary in order to maintain our evidence-based ratio requirements within the agency. And also, well, I guess that's it. Next, I'd like to just introduce Dr. Michael Menev. He is our medical director, and he will be taking on the presentation now for our prison medical agency.
Hi, this is Michael Menev, Medical Director for MDOC, Chairwoman Carlton, and committee members. Thank you for your opportunity to speak to you today. The Nevada Department of Corrections has been proactive and flexible during the COVID-19 pandemic through the implementation of agency-specific CDC and local health authority guidelines. With the advent of the COVID-19 vaccine, the NDOC is currently prioritizing vaccination efforts on all eligible staff members. Given that staff members are constantly interfacing with their communities, they are most likely to spread the virus to other staff and to susceptible offenders. As of January 20th, 2021, 746 NDOC staff members have been vaccinated for COVID-19, which is approximately 28% of all NDOC staff members. Town halls and education of staff and offenders continues on a weekly basis with the aim of increasing compliance with this life-saving vaccine. Offenders will be vaccinated in order according to the designated age cohorts created by the Department of Health and Human Services. The NDOC has been approved to administer the COVID-19 vaccine at its major facilities and will continue to work with local health authorities to procure sufficient vaccine to administer to inmates and staff members. The close collaboration of the Nevada Department of Corrections with the Governor's Finance Office and the Division of Emergency Management has yielded personal protective equipment for all NDOC staff and offenders. At this time, NDOC staff and offenders have sufficient personal protective equipment through April 2021. In addition, the acquisition of approximately 40,000 BinaxNOW rapid COVID-19 test kits has allowed the NDOC to more effectively identify infected staff and offenders in a timely manner. The NDOC currently tests both staff and offenders for COVID-19 on a weekly basis. Weekly testing for COVID-19 has not only reduced the frequency of offender outbreaks, it has also facilitated the clearance of staff to return to work in a more timely manner. The NDOC continues to identify and treat offenders infected with hepatitis C. As of January 21st, 2021, our medical providers have identified 749 offenders with active hepatitis C infection. 166 of these offenders are priority level 1 offenders according to Medical Directive 219. Initially, the NDOC had forecasted a total of 2,400 hepatitis C positive inmates based on intake data in addition to estimates provided by the American Association for the Study of Liver Diseases. NDOC Medical has partnered with Hope's Clinic in Reno to facilitate the treatment of these offenders. So turning the presentation back to Deputy Director Christina Shea.
Thank you, Dr. Manav. Christina Shea for the record. So just want to provide a brief overview to the committee members of medical inflationary rates that are included in the governor's recommended budget for the 21-23 biennium. First off, just so the committee is aware, the department used DHHS actuary using Bureau of Statistical figures to actually come up with the recommendations. And as you can see on the screen, it's roughly 3.8 to 3.9% of inflation that has been built in. I do want to bring it to the committee members' attention that the rates that are listed on the screen only encompass the medical expenditures associated with the CAP 50 inmate-driven medical expenditures that are associated with inflation, and there are actually other charges outside of this list that make up the total rate. So as indicated in the governor's recommended budget, there's $5.9 million of general fund appropriation for inflationary costs. Additionally, the recommended rate based on the 21-23 biennium is $2,024 per inmate in fiscal year 22 and $2,136 in fiscal year 23. And therefore, when you compare this to the fiscal year 21 ledge approved rate of $1,696, we're experiencing roughly a 19% increase in our medical rates, including inflation. So now I'm going to pass the presentation over to Didi Kawenga, who's our DD over Prison Industries, and he's going to give the committee a brief overview of prison industries.
Good afternoon, Madam Chair and members of the committee. Deputy Director Kawenga with Prison Industries. In prison industries, our mission is to reduce government operating costs, provide offenders the skills necessary to successfully re-enter society, and enhance the safe operation of correctional facilities. How do we fulfill this mission? We provide prison industries a self-sustaining operation. It provides meaningful work and job training to include certifications for offenders. What we do, we have operations in most of the major facilities. At Northern Nevada Correctional Center, we have a furniture shop, metal fabrication, French shop, embroidery, screen printing, mattresses, and reupholstery, as well as auto refurbishing. At Lovelock Correctional Center, we have a garment factory and a drapery factory. High Desert Correctional Center, we host a card sorting and a hanger sorting operation. Southern Desert Correctional Center hosts an automobile refurbishing and repair shop. New industries within the last year, we brought in All Wire, which has come in with a new company that produces wiring harnesses, manufacturing of cable assemblies, printed circuit board assembly, and electromechanical assemblies for high reliability commercial applications. Also within the industries, with the COVID pandemic, much of the world found itself a shortage of personal protective items. Silver State Industries filled the gap by producing hand sanitizer, face masks, face shields, and gowns. On our growth, also at the ranch, Stewart Conservation Camp, we have a huge contract with Bureau of Land Management, and it's home to the ranch at Stewart Conservation Camp. We have a dairy and a horse training program. At this time, we are involved in a bid that we're looking at. We have a 2,000 capacity of horse head at Stewart Conservation Camp, and BLM is looking to see if we can double that size. Some of the challenges, let me back up. We have 500 to 600 inmates working at our prison industries. Some of the challenges that we are looking forward to seeing up here that we see coming towards us is reduction in retained earnings. During a special session, the legislature authorized a transfer of retained earnings to the general fund in the amount of $200,000 from prison industries and $300,000 from the ranch operations. COVID-19, like most businesses, Silver State Industries took a hit with COVID-19 due to loss of work days, gaps in the supply chain, and inconsistent customer base. Shortfall in the state budget, with all state agencies tightening their belts, we anticipate fewer discretionary funds to purchase items such as furniture and uniforms from Silver State Industries. But we continue to strive to work with other agencies and still accomplish and provide them with products. Thank you.
Madam Chair, this is Director Daniels, and that concludes our formal presentation. And I certainly open this portion up for questions.
Thank you, Director Daniels. We appreciate the presentation. It's nice to see Ms. Shea. Congratulations. With that, I believe Speaker Frierson had a question and comment for you.
Thank you, Madam Chair, for the indulgence. I just wanted to thank the director for the meetings that we've had in recent weeks about not only what's going on right now, but what the vision is for the future. It communicated, I think, a serious approach to wanting to address culture and policy and community that I really appreciated. Director, you made some decisions that I know could not have been easy in recent months and are not typical, but were the right thing to do, and I wholeheartedly support those actions. I'm on the fence about whether or not I wholeheartedly support your snatching Ms. Shea from us, but you have certainly surrounded yourself with an excellent team. I've worked with Ms. Shea as well as Mr. Williams and Mr. Wickham, and you all are communicating that you're taking this serious, and I appreciate it. So I'm looking forward to working with you and following through on some of the vision that you discussed with me, and look forward to it.
Speaker Frierson, thank you for the very kind words. I really appreciate it. We're very, very tickled to have Deputy Director Shea, and I have a very competent team now, an executive team, and they all have a lot of integrity and character, but more importantly, they all care. And they see what we're doing as a mission. We've got to change how corrections work and help out in our preparation for returning these individuals back to society. I am just tickled right now with the group we have. We have some challenges. We're going to continue to grow and to learn. And once again, thank you for taking the time to speak with me. And once again, I appreciate everything, just like with the rest of the committee.
So with that, committee members, I think we could go ahead and open it up for questions. I believe Dr. Titus, you had a question?
Yes, thank you, Madam Chair. I appreciate that. And thank you for the presentation. It's been a long road with prison, with the hearing about medical care and access to care. And I just needed some clarification. And I know during our subcommittee hearings, we'll get some more details. But just to clarify what I think Dr. Mendez said was that there are currently identified 749 offenders with hepatitis C, but that's not active hepatitis C. Is that correct, Doctor?
This is Michael Menev, Nevada Department of Corrections. We have 749 total offenders at NDOC with hepatitis C at this time.
And you've identified of those, the 166 that have active disease. So you're going to, that $6 million one-time ask is for the 166 that have.
I'm sorry, can you repeat your question? You got cut off at the end.
Okay. Your one-time shot appropriations, you're asking for $6 million for hepatitis C treatment. I'm guessing that, and I think you said you had 166 active cases. So is that $6 million treatment for those 166 active cases?
Thank you, Assemblywoman. Assemblywoman Titus, thank you for the question. So just to confirm, just to clarify, the agency received funding at the IFC contingency fund, and it's our understanding that we're going to be able to treat the 160 active cases with that funding in this fiscal year, and therefore the funding in that would be the one-shot appropriation for the 21-23 biennium would be any of the cases that we're not able to treat between the 600 that we have allocated right now and the difference between the 712. So roughly, what is the difference between that population, if that makes sense.
Right, and those are the kind of numbers I'm going to be looking for because we have talked about this at IFC, and we know that there's a lawsuit regarding whether the treatment for hepatitis C. And I just need some clarification on what has already been spent on the treatment, how many folks have we actually been able to treat, because we know that there is now a cure. So how many of those have been cured with that? And then this money is for, this $6 million then is not to treat the 166 active cases. This is just a projection of more cases to come.
So just to clarify, Assemblywoman Titus, thank you for the question. The Nevada Department of Corrections received roughly $7 million. That's not an exact figure because I don't have that number right in front of me, and I can provide it to you, to treat roughly 600 inmates. And then the idea was that there was going to be additional inmates that had to be treated the next year. So another 600 inmates. And then after that, it was going to, so there was a tiered system approach. However, the department has realized that it doesn't have 2,400 total inmates. It really only has the 700 number that Dr. Menev has indicated. So therefore, we're going to be able to treat most of the inmates with the monies that have been allocated from the IFC contingency fund this fiscal year, with the remaining inmates that we haven't treated falling into the money that would be used in the one-shot appropriation in the next biennium.
Great, thank you for that. And then another question. So are you testing every new inmate on whether or not they have hepatitis C? And then is it the state's obligation to treat every inmate, that even if they've come in with pre-existing disease, or are we treating those that convert while they're in prison?
This is Michael Menev, Medical Director. Yes, we are treating individuals that come in with existing hepatitis C. We're also testing all incoming inmates for hepatitis C. In both situations where we are treating those individuals. And just to clarify your question earlier, we currently have a total of 749 offenders statewide that have hepatitis C. 166 of those offenders are categorized as priority level 1 under Medical Directive 219. Those are the individuals that have the high fibrosis scores, F3, F4, those individuals with liver cirrhosis. The sickest individuals are in our priority level 1, and those total 166 inmates.
Great, and so just to be clear, this isn't a disease that you treat one time and then you no longer have hepatitis C in the prison system. So I want to make sure that we're not just thinking that this is an ongoing problem, something that we need to make sure we're aware of, because these folks, it just doesn't stay there in the prison, and it actually does filter out. So I'm supportive of treatment and offering hope to these prisoners, because treating it is small investment to the other health outcomes, whether it be family members or long-term complications, as you mentioned, the cancers, other health issues. So I just wanted to make sure we have more of a vision, and I would love to see what your plan is for overall treatment and how you plan on dealing with this down in the future and some long-range planning. So I thank you for the questions, Madam Chair, and looking forward to further dialogue.
Thank you, Dr. Titus. Other questions from other committee members at this time? I don't believe I'm seeing or hearing anyone else wishing to be recognized at this time. So thank you, Director. We look forward to working with you and addressing a number of the issues that corrections has had, at least in my tenure on Ways and Means. And hopefully we can find some solutions to some of these problems, and working with your new team. So we appreciate you being here and going through the documents with us today. And I'm sure if there's any other questions, individual members will be reaching out to you with their concerns. So with that, thank you very much. I believe that closes that agenda item for today. And I believe that pretty much takes care of our presentations for today. We will now go to our second period of public comment. It is 2:51 by my clock, so we'll give it a couple of minutes for folks to be able to join us for public comment. So committee, if you would just stand at ease for a couple of moments, and then we'll come right back. So with that, committee members, I have 2:53 broadcast services. Do we have anyone in the queue for public comment this afternoon?
Chair,
Good afternoon.
the line is open and working, but there are no callers.
All right, thank you. I've given them the appropriate amount of time. So committee members, thank you all very much for your work today. We are done, and tomorrow the committee will be chaired by Senator Brooks. So with that, committee, we are adjourned. See you tomorrow morning at 8:30. Have a good afternoon and evening.